All right, thank you. Yes, oh, you have another, oh, perfect, thank you. All right, that's 1804. All right, thank you. And you want to approach on the other issue? All right, yes. All right, we ready for the jury? Okay. All right, thank you, ladies and gentlemen. All right, be seated. All right, the plaintiff has rested in the defense case. Your witness,
Your Honor, I'd like to call Dr. Don Hughes to the stand.
Dr. Hughes.
Do you solemnly swear or affirm to testify truthfully in this case for penalty of law? Yes, I do.
Good
afternoon, Your Honor.
Good afternoon.
Good afternoon. Thank you, Your Honor. Will you please state your name? Dawn Hughes. And what is your profession?
I'm a clinical and forensic psychologist.
And where is your practice located?
I practice in New York City.
What is a clinical psychologist?
Sure, so a clinical psychologist is somebody who assesses, evaluates, and treats individuals who are suffering from a variety of ailments or problems that they have in their lives. It could be a major psychiatric disorder, and it could be problems in living. Clinical psychologists also participate in training, in education, and in research ventures.
And what is a forensic psychologist?
So a forensic psychologist is someone who applies the science and principles of clinical psychologist to a particular legal question at hand.
And please describe your background in terms of your education.
So I received my bachelor degree in psychology from Hamilton College, which is in upstate New York. I then received my master's degree and my PhD from Nova Southeastern University, which is in Florida. I then had to complete my year-long internship, and that was at Yale University in the School of Medicine in the Department of Psychiatry. And there I did 2 full year rotations. I did a year rotation in the substance abuse treatment unit and another year rotation in the West Haven Mental Health Clinic, where we saw individuals suffering from a wide array of difficulties in psychiatric
Correct.
illnesses.
From here on out,
After that, I had to complete my postdoctoral
It will be
fellowship, which is
team heard
another year
witnesses
that's required in order to get licensed. And that was
Until they're
back in
done.
New York at Cornell Medical College in the anxiety and traumatic stress program there.
Please describe your training and experience in psychology and trauma.
So my experience in trauma has been predominantly throughout graduate school. I started at a domestic violence program that was housed within our community mental health center of the university. And that program, we saw both men and women who were coming through the program. The majority of the men were court ordered for batterers intervention programs to participate in mostly group therapy. Because of their behavior in intimate partner violence, domestic violence. We also treated the female victims who were victims of intimate partner violence and mostly in individual therapy, but we did run some groups there as well. After that practicum experience, I went to work at the Veterans Administration in their outpatient psychiatry clinic. And in that clinic, I treated mostly this was Florida, so they're much older adults. So we saw a lot of Vietnam era veterans and actually World War II veterans in that program, and a few of veterans who served combat in the first Iraq War. Sort of overlapping in that time, I also was the research coordinator for the Child Sex Abuse Survivors Program, and that was also a treatment program that was housed within that same community mental health center. And we saw individuals, both men and women, who were coming for treatment to deal with the consequences, the psychological after effects of having been sexually abused as a child. After that, I completed my internship when I was at Yale at the substance abuse program, because we know there's a high concordance, a high rate of trauma-based disorders with substance abuse. I put together a group, a women's group of female heroin addicts, recovering heroin addicts who also had either domestic violence or childhood abuse histories. So we did a dual substance abuse harm reduction model with the healing from the traumatic effects of the violence that they experienced. On my postdoctoral fellowship, I was in the anxiety and traumatic stress program. As the name sounds, we saw individuals who were suffering from trauma-based disorders and anxiety, mostly late adolescents and adults, men and women, from rape, sexual assault, violence. Some were simple assaults on the streets, being mugged, and things of that nature.
So you already know where we're going
I
with
also
this.
did teaching and training for Victim Services, which is New York City's largest victim-based organization who runs a lot of services for victims of domestic violence and shelter-based programs. And I did some education and training for them and teaching for a number of years.
Thank you. Let's talk about your current occupation. What positions do you currently hold?
So I currently have a private practice in Manhattan, and I also have a faculty position at Weill Cornell Medical College. I'm a clinical assistant professor of psychology in the Department of Psychiatry there. This is what we call on the voluntary faculty, which means you don't get paid, but you participate in bringing in the interns, selecting the interns for that year. In that program, I teach, I think for the past 7-8 years, the ethics seminar to the interns and also participate in other didactics that they have. I'm also called upon to sort of troubleshoot difficult scenarios that clinicians, either trainees or full-fledged clinicians might have. If there's an issue of intimate partner violence or child sex abuse and they don't really know sort of what to do in that situation, I get consulted to do that. And then most recently, I was part of our program's COVID response team, where in pretty much March, April, May, June, July 2020, where New York City was the epicenter, we sort of mobilized and were really doing psychological first aid and helping our hospital-based workers deal with the stress and the trauma from seeing so much death and destruction because of COVID in those first months of New York City's COVID wave.
What does your independent practice entail?
So my independent practice is predominantly, I say 3 things. The bulk is I see individuals in therapy, 2.5 days. I see people who come to my office who are mostly dealing from, the traumatic effects of victimization, childhood abuse, rape, sexual assault, sexual harassment, domestic violence. And I see these individuals in therapy. I do have a percentage of individuals who do not have a trauma history, and that's usually the anxiety disorders that I see. They may have panic disorder or generalized anxiety disorder or other difficulties in just relational difficulties or problems in living. The second big part of what I do is this forensic psychology. Like
Watch for distractions and perception
Who
games.
were involved in legal matters. I consult with prosecutors and district attorneys and U.S. attorneys on their cases, and just something that has to do with the legal system. And then the other smaller percentage is the engagement in professional activities in the profession.
Do you have any areas that you specialize in?
Yes, I specialize in interpersonal violence and traumatic stress.
And what is interpersonal violence?
So interpersonal violence is the umbrella term for when one person does something violent or abusive toward another. And that includes domestic violence, childhood sexual abuse, rape, sexual assault, sexual harassment, physical assault, all of those type of behaviors.
Watch for how their
understand as
story
interpersonal
differs.
violence. And
Watch
then
for things
traumatic
that they
stress
say
is the
that are
consequence of that.
distractions.
What happens to individuals when they experience these sort of life-altering events, these really adverse life events? Traumatic stress is one of the outgrowths.
Sorry, I'm trying to
and
hear at the same
psychological
time.
consequences that people have when they've been exposed to these type of traumas.
So intimate partner violence, rape, and sexual assault are major areas of your focus of practice?
That's
Is that fair to
correct.
say?
Objection leading.
I'll sustain objection. Okay. I'll just move on. What types of patients do you treat in your private office?
So I treat adults, mostly men and women in my practice. I sometimes will treat late adolescents, 17 or 18. And they'll come to me usually after a rape or sexual assault, and I'll treat them in short-term treatment. But mostly adults who are, have sustained some kind of traumatic event in their lives.
Approximately how many victims of interpersonal violence have you examined or personally interviewed over the course of your career?
Hundreds upon hundreds.
And how many years
No
have
joke.
you been practicing?
Well, I started practicing in graduate school in 1992 and I was licensed in 1996, so 25, 30 years.
Okay. Are you board certified?
92 would be
Yes, I
30.
am.
Please describe to the jury what board certification means and what you are certified in.
Board certification is the highest degree of postdoctoral certification that a psychologist can obtain. And I am board certified in forensic
This is to be
psychology,
expected
and that means that I
because
have
it's
just
her
amassed,
witnesses.
a competency in the testify and training just regular sort of mental health professionals on how to understand trauma, how to look for trauma, what does it look like when it comes into your office, how do you treat it, how do you assess it, all of those factors I've done a number of trainings on.
Have you been invited on any occasions to train attorneys and judges on trauma and violence?
Yes, I have. I was invited by the judicial conference to be part of the training curriculum to train our New York State Supreme Court justices on issues of intimate partner violence and traumatic stress. Some of the things that I've just been talking to you here about how to understand what happens in those situations, how to understand the myths and misconceptions that may abound in these situations, and how you can sort of more accurately understand what a victim is talking to you about and telling you when they come into your courtroom.
Have you given any presentations to judicial symposiums on domestic violence?
Yes, I've also been contacted by, sometimes judges will have symposiums in their courtroom. They will make a decision to hold a particular symposium on.
The title sure
topics, and
does.
I was, asked to come do presentations for judges on numerous occasions.
And what, if any, presentations did you do on understanding women's use of force in IPV?
That was a recent presentation, and I think that was invited by one of the judges of the Office on Domestic Violence in New York. And the title is When Women Use Force in Situations of Intimate Partner Violence. And my topic was to talk about the complexities of that issue and what does that look like and how can we differentiate if both people are fighting. How do we know that this is intimate partner violence? So what does the research tell us about that? How do we understand that, and how can we really accurately assess that? And that was sort of the bulk of what that training was about.
What professional organizations do you belong to?
I belong to a number. I belong to the American Psychological Association, which is the largest body of psychologists in the United States, over here, headquarters in DC. Because it's so big, there are subdivisions of American Psychological Association. So I belong to the division of trauma psychology. I belong to the division of psychology and the law, the division of psychologists in private practice. I belong to other organizations, the International Society for Traumatic Stress Studies, which, as the name says, it's an international society where we are interdisciplinary, mostly psychiatry and psychology, researchers and clinicians, to really understand and further our awareness.
It'll come
about
down to
trauma and traumatic
likability and how the
stress.
jury
I belong
perceives
to the
them.
International Society for Trauma and Dissociation. I belong to the Anxiety Disorders of Association of America. I'm a fellow in the American Board of Forensic Psychology. I don't know if I'm forgetting any.
Okay. Are any of these specific to interpersonal violence or trauma?
Well, clearly the trauma division of the American Psychological Association, the International Society for Traumatic Stress Studies, and the International Society for Trauma and Dissociation, and then also the Anxiety Disorders of Association continues to talk about trauma, because prior to this new DSM-5, PTSD was originally categorized under the anxiety disorders. So there are still colleagues and researchers in the anxiety disorders organizations who talk about PTSD and trauma.
Do you hold any leadership roles in these organizations?
Yes, I am currently the president-elect of the trauma division of the American Psychological Association. That is an elected position. You have to be elected by our membership. And now I serve as with the presidential trio. So there's three of us. You serve with the immediate past president, the current president, and the president-elect. So it's a 3-year term. And what we try to do is continue to disseminate best practices in trauma psychology and also interface with the larger American Psychological Association organization to continue to disseminate best practices and have just a voice for trauma psychology with our larger body and
From
policy
here on
making.
out, they will be.
I've been involved in the Trauma Psychology Executive Board since its inception. I was a founding member of that division. I served as a membership chair, a program chair, an awards chair. I was the APA Council of Representatives, which means I was also elected to serve a 3-year term and sit on the governance board at APA, representing the Division of Trauma Psychology. So I've been very actively involved in the trauma division.
And what is the Division of Trauma Psychology?
So the Division of Trauma Psychology are psychologists who come together who want to disseminate best practices in trauma psychology. We want to make sure that we have our finger on the pulse of research and evidence-based interventions for people who are struggling with traumatic events that have happened to them.
He's over there drawing.
Have you served in leadership positions of other professional organizations?
Yes, I was, there's a New York City-based organization, it's called the Women's Mental Health Consortium, and that's also an interdisciplinary organization. It's psychology, psychiatry, nursing, social work, and this was formed in order to give women sort of a referral base and more information about mostly like reproductive psychiatry. We know that certain difficulties and psychological difficulties that you have can erupt when you're pregnant or postpartum. So we wanted to have a number of resources available to women in the New York City area. I was a membership chair there for a number of years, and then I was the president of that organization, I think 2009 to 2017. I don't have my CV, but I think that's about right.
Why is participation in professional organizations important in your field?
Well, it's important to me because I do believe very much in service. I do believe very much in giving back. I do believe that it's important as a psychologist who believes strongly in trauma psychology and helping people that I can be part of a voice at the table, part of that push to get policy and understanding, especially with the
I
insurance
noticed
companies,
that. Hilarious.
to make sure that people are getting, the appropriate care that they deserve. So it's something that this has always been part of my life in varying degrees, and as a psychologist, I feel like it's a very rewarding part of my job.
Do you attend professional conferences?
Yes, I do. Typically multiple times a year. Of course, COVID threw a little bit of a wrench in that, since some things are virtual. But yes, I routinely attend conferences.
And why do you think that's important?
It's important to stay abreast of developments in the field. It's important to meet with your colleagues across the country and see what they're doing and what they're hearing and what's working and what's not working. So when you're at a conference and somebody's presenting new or novel research, then you can take that information and bring that back to your clients and bring that back to my forensic work. So it absolutely enhances the work that I do.
Have you ever been qualified to testify in the field of psychology as an expert witness?
Yes, I have.
How many times?
I was first qualified in 1998, so since then, about 50 times.
And how often in that 50 times has the specialty been in interpersonal violence and traumatic stress?
Probably more than half.
Okay. Have you ever worked for or testified for the prosecution in criminal matters, like the district attorney's office, U.S. attorney's office?
Yes, I have, frequently.
Okay. Do you testify for both sides in lawsuits, plaintiffs and defendants?
Yes, I do.
Have you ever worked on other cases that didn't go to trial?
Many.
Have you ever found an individual that you evaluated did not suffer from the effects of interpersonal violence or PTSD?
Frequently.
Have you ever not been qualified in court where you have been proffered to qualify as an expert in the court?
No.
Your Honor, I would at this time move to qualify Dr. Hughes as an expert in forensic psychology with a specialization in interpersonal violence and traumatic stress.
All right, any objection?
No objection to qualifying her as an expert in forensic psychology.
More specifically, forensic psychology with a specialization in interpersonal violence and traumatic stress.
Any objection?
Get that correction in there.
All right, so moved.
Thank you, Your Honor. Dr. Hughes, please tell the jury what domestic violence, intimate partner violence means.
Sure. So I'm probably going to be interchanging the language, domestic violence and interpersonal violence. And for purposes here, these are the same thing. So intimate partner violence is a pattern of manipulation, fear, and coercive control that happens within an intimate relationship. It constitutes using a variety of abusive behaviors, and that can be physical violence, sexual violence, psychological aggression, emotional abuse, stalking or surveillance behaviors, and economic abuse. The abusive behaviors occur over time, not all at once, and they're also interspersed with very normal times, times without violence, times with love and happiness. And it's this interpositioning of the violence with the love and the abuse, with the love and the care, that makes it very difficult for a victim to extricate herself from that situation and from that relationship.
And what would you say is the overarching dynamic of these relationships?
So the overarching dynamic is the abuse of power and control of one person wanting to have dominance in that relationship, say over most things that the couple or that the victim does or does not do.
Please tell the jury what coercive control means.
So coercive control is a tactic of victimization. The goal of it is to establish dominance. What coercive control does is that it imposes negative consequences for noncompliance with your partner's expectations or demands. And what that does is it erodes away at the victim's autonomy and her independence.
What is physical violence?
So physical violence is when one person uses their body against the body of another with the intent to cause injury or harm. That can be push, shove, slap, kick, punch, beat up, meaning multiple types of physicality in one instance, throw, slam into a wall, push into something hard that you could hurt yourself. Clearly, use of a weapon would be a physically violent act as well.
Does size and strength matter between the parties?
Yes, very much so. This is very well documented in the literature about violence and abuse in relationships, and that's just physics. That's just proportional force. That if a 185-pound man is going to push a 120-pound woman, that's going to feel quite different than a 120-pound woman pushing a 185-pound man. And it's just about proportional force and the size and strength differential. And that is why specifically, if you look at wrestling or boxing, they match weight classes. And they do that for a reason, because they know that it's not fair if somebody is bigger and stronger than the other. So it's certainly not the only factor, but it is a factor that one has to consider if a relationship is violent.
What is psychological aggression?
So psychological aggression is threats and the imposition of threats with the intent to control someone's behavior. So it's doing a threat so that you will modify your behavior and do what your partner wants. Some psychological aggression techniques are intimidation, slamming your hand on a table, punching a wall, throwing something, mumbling under your mouth, cursing, screaming, sort of these high emotional balance type of activities that can cause a victim to feel afraid and feel intimidated. And then if there has been an act of physical violence where that contingency has already been established, that
She
this
claimed that
person,
she
your partner,
was
has said,
in the
okay, I
op-ed.
not only have the ability to use violence against you, I also have the willingness to do it. The intimidating tactics take on greater flavor. They take on greater salience. They need more because you know what could be coming down the pike.
What is emotional abuse?
So emotional abuse functions to denigrate a person's sense of self-worth and their self-perception. It's about name-calling, being very mean-spirited, putting yourself down, using gender-based language that's offensive, racial slurs, all types of behaviors to really make a person feel less than they actually should.
And what is sexual abuse?
So sexual abuse in an intimate relationship functions to establish dominance and established power. What it is simply in the psychological and psychiatric communities is forcing someone to do something sexual against your will when you did not want to. It can be forced sex, either forced vaginal, oral, anal sex, and be forced to engage in any other type of sexual act that you may not want to do. And when I say forced, it doesn't mean it has to have physical force. There's a lot of psychologically coercive tactics that are used that many times when violence has already been established in the relationship, the victim often feels that she can't say no for fear of reprisal, for fear of retaliation, for saying no to those acts. So sexual abuse, does happen in intimate partner relationships. A lot of people don't want to talk about it, and they don't want to ask about it because it makes people very uncomfortable.
Is digital penetration of the vagina sexual abuse?
Person leading,
What, if any, role does digital penetration of the vagina play in sexual abuse?
If it is non-consensual, then it is abusive.
Digital
What if any
penetration.
Penetration of inanimate objects into the vagina
Is-
plays a role in sexual abuse.
Again, the operative word is
Go to the
consensual.
comment
If
section.
you are not consenting to those acts, then it is sexually abusive.
Is there a distinction between sexual violence and sexual abuse?
Not really. Sexual violence is a term of art. It is the overarching umbrella that we in the psychological and psychiatric communities talk about. So if we are looking at our diagnostic and statistical manual and say, what are the traumas that could cause PTSD, it's listed as sexual violence.
I'm glad
So
y'all
it's an
understood
umbrella
that.
term that allows us to understand it could be childhood sexual abuse, it could be a rape, a sexual assault, it can be sexual abuse in an intimate relationship. So it's really just an overarching term that we use in the field.
What are
So I
some?
just- I'm sorry. So it doesn't mean, I think people often mistake it to mean that when you are being sexually abused, that someone's punching you, or someone's hitting you, or someone's doing something like that because you hear the violence. It does not mean that. That could happen, but that term does not require that, nor does it mean that.
Who thought
What
that
are
it did?
stalking or surveillance?
Is that how
behaviors?
y'all took sexual?
So
That's not how I
stalking and
took it.
surveillance behaviors are a common tactic of typically men who use violent behaviors in an intimate relationship. What they do is they allow the woman to know that wherever she is, wherever she goes, he's gonna know. I'm going to maybe look at your phone, see who you're talking to, track you on Find My iPhone, look at your Instagram, look at your emails, really having a way of knowing all of the personal information about you. And what that does, it again erodes the victim's autonomy and it erodes her sense of privacy. She doesn't feel that wherever she can go,
This is what I
that
was
somewhere
telling y'all to
he's
look
not
out for
going to be,
earlier.
part of her life in a very objectionable way. Sometimes there's the pop-ins that show up at places that they're not supposed to be and that we don't want them to be, just as a way of checking. Sometimes they'll have friends or family check up on their partners to make sure where they are. What time did you get home? But you didn't turn off your phone at this time, but you came in the door this time. Like all of this sort of constant questioning and interrogation about an individual's whereabouts.
What about economic abuse? What is that?
So economic abuse is a way to, again, continue to maintain control over your intimate partner. Sometimes it's withholding information about the finances, of not letting you have access to the finances. If you can't have access to a credit card or a checking account
And
or
clearly she did.
Apple Pay on your phone, then you're rendered usually much more economically dependent on your partner, and that limits tangible options for you. For individuals where that sort of tangible options isn't there, we see the economic abuse or the economic restriction when one partner refuses to share any information about the funds. So it's not like I can't go shopping because I won't have money, but I don't have any decision making in our family money. I don't have any idea of what we're doing in our family vis-a-vis our finances. So it's a way of definitely keeping that very separate and not in a consensual. Some couples make that choice. One person does all the money, that's fine. But when it doesn't come from a place of consensual choice making, it can be abusive.
So you just described.
That was
these
lacking real
abusive
context,
behaviors.
in my opinion.
Are all of them present in every domestic violence relationship?
Right, no, they're not all present in everyone, and that's why it's
We don't
very
know their
important
financial
to
arrangement.
do a thorough assessment of a relationship that may be mired in violence to see which ones are present and which ones have a great impact in the relationship, which ones are sort of making the structure of this relationship.
After a sexual assault in an intimate relationship, how might a victim in those circumstances interact with her partner?
So this is one of the myths that people say, well, if she was sexually assaulted by her partner, she would have just left. And nothing could be further from the truth. That's not what happens, especially when it's your husband or your boyfriend or your partner. So what women do is they bury it, they compartmentalize it, they put it away, they avoid it, because then they continue to reach out for the kind and the loving man that they got into this relationship with. The problem is that it does fester belief and causes more sort of psychological distress in the victim.
What, if any, role can shame or humiliation play in this coercive dynamic?
So that's one of the emotions that the victim is usually trying to suppress and compartmentalize and avoid and put away. One of the most frequently felt feelings after something so incredibly humiliating and violating is shame. And shame is a very sort of difficult emotion for people to have to live with and to have to experience. And then a lot of times what we see in these relationships, especially ones where sexual assault is perpetrated, there's typically the emotional abuse as well. So now if you're called names like a whore and a slut and easy and fat, and you're feeling the shame from the sexual assault that just happened, it sort of acts as a compounding effect, and it sort of kind of slowly deteriorates the psychological functioning of the victim, and where they're just really trying to get back to the good guy, get the good guy to come back, but they're suffering these symptoms underneath.
What about intimidation? What role does intimidation play in the coercive control dynamic?
And intimidation is one of the huge factors that we see in coercive control. Again, the goal is to get your partner to do what you want them to do. And if you've established that you can use violence and other sexual violence and physical violence, slamming your hand on a table, throwing a glass, breaking a door, throwing anything, causing a fit, yelling and screaming, that can rise the fear level in a victim that she may modify her behavior quicker, and he might not need to use physical violence because he's already established that fear is there.
What, if any, role could writing obscene messages play in being considered an intimidating behavior?
That would-
Objection leading.
I said, what, if any?
Overruled. I mean, certainly writing obscene messages to your partner could absolutely be an intimidating behavior.
What, if any, role does emotional abuse or degradation play in the dynamics?
So emotional abuse and degradation, as I stated before, functions to decrease your sense of
Also,
self-worth.
she's
It
speaking
decreases
in
your sense of
generalities.
agency.
Like,
It
she's
makes
not
you feel
speaking
bad
about
yourself. And when you feel bad about yourself,
Amber and
you're
Johnny.
less
She's
likely
speaking.
to actualize
in
and see
generals.
options for leaving. You're so sort of
Hopefully
mired
everyone's
in-
like picking up
in
on
this
that.
dynamic of abuse that you come sometimes to believe the bad things that the person is telling you about. So, maybe I am not talented and fat and lazy and stupid, and it interferes with that ability to problem solve and figure out, can I get out of this relationship? And sometimes you feel you don't even deserve to get out of the relationship when the abuse is so chronic and so repetitive.
What role does surveillance
And
as a
that's what
means
they
of control
want.
play in that dynamic?
So surveillance.
Objection leading.
I don't think that's leading.
Overruled. So surveillance functions to let the victim know wherever you are, there I am. So it makes her feel
I
not
feel you.
secure in her movement, feeling that she has to restrict her movement. Her movement is not hers alone. It usually increases hypervigilance. It increases fear. It increases the need for yourself to mark where you've been and what you've done so that you can go back and prove it to your partner, because you know that there is going to be an interrogation.
I told y'all it would
This-
change
this
when it was
pattern
their
has been
witnesses.
established. Show receipts, show me your iPhone. Where were you? What's your Google location at? Those are some types of surveillance behaviors that puts the victim very much on edge and increases that level of anxiety and trepidation.
What role does possessive jealousy play in these relationships?
So possessive
Again,
jealousy
generalities,
is a very,
not
difficult
specific to
dynamic
them.
in intimate partner violence. It's very common in situations of coercive control. It's rooted in possession, that the gentleman feels that he can possess her and that he can have her whenever he
Yes,
wants.
we
It's
did.
very possessive dynamic. But the accusations, the
This.
problem is when you make the accusations, the woman's forced to refute the accusations. So they're continuing in this dynamic where she's trying to prove, I didn't do what you said, this didn't happen. And then unfortunately, sometimes it escalates because the man is not taking the no for an answer, because this is a perseverative obsessive pattern that's very difficult to penetrate, that often these type of
Show motherfucking
conversations
did.
lend themselves to physical and sexual violence.
Does this dynamic happen overnight?
No, it doesn't happen overnight. It happens over time. We don't, a woman doesn't get into a relationship with a man who's beating her up and
Struggle
sexually
bus.
assaulting her and calling her names and doing all that. She gets into the relationships for all the right reasons, just like we all get into
Yes.
relationships for love, for companionship, for kindness, for a future. But then slowly, all of these behaviors start to take form. And I say it's sort of like sucking the oxygen out of the room. And then before you know it, you're suffocating.
So, and that brings me to my next question. What role do physical abuse and coercive tactics play interspersed with normalcy and positive moments?
She's already been accepted.
Objection compound.
Sustained objection. Yeah. I'll figure this out some way. What role does love and normalcy play in these dynamics you've been describing?
Objection compound.
Overruled. Thank you.
So love and normalcy are almost always in these relationships. That, when you are in a lull and the violence is not happening, you're back to sort of the loving man that you wanted, the person who you wanted to be with. And when you pair sort of this violent dynamic, physical violence, sexual violence, with love and attachment, it creates a trauma bond. It creates a psychological bond. An emotional dependency is created. So it makes it very difficult for the victim of the abuse to sort of extricate
Compound
herself
objection
from
is
that
when the
relationship,
lawyer is
and for her
asking
to
multiple
believe,
questions as if it's
frankly,
one.
And that takes a lot of time to even believe that she can and that she should.
And what, if any, role does that dynamic you've described have in the victim thinking they can fix the problem?
So what do we know from the research? The researchers working with battered men when they come into treatment is that the only person who can change the abuse is the abuser. So no matter what the tactics that the woman uses, she's trying to do all these different things to fix him, to have him not be violent, to have him not be sexually violent, to have him not be obsessively jealous. And all those things don't change his behavior because it's up to him to change his behavior. And this was played out a million times in the batterers intervention groups. that I
Don't you
work
love
with.
how
And
she's
that
talking
was
in
ours. It doesn't matter what
generalities, but
does.
she keeps
I don't
saying
care.
she, him?
So the problem is
Mind
that
games.
the woman continues to
Pay
think that
attention.
she can fix it, and yet she can't. But she's the one who's then rendered sort of helpless and hopeless because everything that she's trying to do is failing.
What is the cycle of violence?
So the cycle of violence is one way to describe this domestic violence pattern. Typically what we see, and the cycle can be different in a variety of relationships, but typically what we see is in the first phase, the sort of multiple 3 to 4 phases. In the first phase, there's a tension building phase. You're sort of starting to feel that apprehension.
Perception,
Maybe
mind
throwing
games.
his papers on the table a little more. He may be slamming the fridge door a little more. He may be mumbling under his mouth a little more. He may grab a glass a little more forcefully than he normally is. And then there's the incident phase. Then there's the blow up. Where the
But see,
violence,
they're
the
talking in
abuse, the screaming,
generalities,
the sexual violence,
hoping
the
to
physical
get
violence.
people
all that
confused and thinking that's what's.
Then we come to the contrition phase. I'm sorry.
that people will
Yeah.
think about this and relate it to these
I'm
situations.
not going to do it again. The promises for change. And then we sort of slide into the calm phase where, this isn't going to happen again. I'm back to stable ground. I want to live in this place, this sort of honeymoon place. The problem in the calm phase is we often see the rationalizations and the justifications for the behavior. It's not like typically the man is taking full responsibility for what he did, but it's calm because there's no, violence and no sort of tension at that moment. And then it recurs, and then it recurs. So you're stuck in this vicious cycle of trying to figure out, how can I be with this man who hurts me? And yet I love him so much.
And what, if anything, does the term love bomb mean?
So the love bombing is, it's more of the colloquial term for the younger folks here, but, where you shower someone with affection and love, in this contrition and calm phase where, you're, everything about you is special. You're the best thing in the world. I'm never going to do anything to hurt you again. I would never let anyone hurt you. And it could be sending
Since she's an
flowers and
expert,
buying
she
gifts
can
or going
give
on
opinions.
trips or your favorite restaurants. And that is, a way of where the man is trying to make those amends. And then it gets the woman hooked. So they get hooked on the kindness. They get hooked on the love. They don't get hooked on the abuse. I've never met one woman in the hundreds and hundreds and hundreds that I've evaluated who was not concerned about the violence. They're all concerned about the violence, but they go for the love.
So, in your experience with these dynamics that you've described, does the victim ever yell at her partner?
Absolutely.
Why?
We know from the research that women use verbal and physical acts of aggression in these relationships. That's not uncommon. This has been researched for 5 decades. And a woman may yell at her partner because she's angry. And anger is a very normal emotion to having been abused. She can also be afraid, but they don't have to be mutually exclusive. We can absolutely, as human beings, feel 2 or 3 or 4 different emotions at once. People do often say to me, oh, she would never yell at him if she knew he was going to hit her. And that's not true. That's just patently not true. That's not supported in the research, and that's not supported in my clinical practice. The problem is there's a classic double bind, and the violence has been so normalized in the relationship now. She gets hit if she does yell, she gets hit if she doesn't yell. So for women who feel at certain moments that they need to preserve some sense of their autonomy and their independence and stand up for themselves, they will yell and they will fight back, even though the risk of violence is there. So it doesn't mean that she's not afraid and that she's not concerned about the violence. And it doesn't mean she doesn't also use placating and compliance strategies most of the time as well.
Does in the cases that you have and in your experience, does the abuse typically take place in front of others?
No, I mean, this is classically what we talk about behind closed doors. Most of the intimate partner violence, the domestic violence, happens, in the privacy of your own home. So sometimes we see the remnants of it, the after effects, or victims talk to their friends or family about it. But very rarely are you seeing it happen, the actual blow-up phase happen in the middle of witnesses and other people.
What's the term bystander effect mean?
So bystander effect means what happens when people are aware that domestic violence is happening? What happens when they're aware, even if they're not seeing it, that it could be happening? And what happens is we know that it's very difficult for people to stand up and say something. It's very difficult, especially in situations where there's a larger community of folks and the person who perhaps is perpetrating the abuse is the leader of that community. It becomes very difficult to go up against that, to go up against the sort of the head honcho of the community. People are very fearful of losing their jobs. I've seen this time and time again in the cases that I've worked on. The Boy Scout cases, clergy abuse cases, all of those type of cases where the USA Gymnastics, where when we go back and we look, we see people knew. But the secretary doesn't want to lose her job. She has kids to feed. The guy who, checks you in, he doesn't want to lose his job because he has a mortgage to pay. So people are quiet and they don't say anything. And then other people are very, it's a very worrisome dynamic. They don't want to put their foot out there if they're wrong, and maybe I didn't see it right, or I don't really know what happened. I certainly am not going to jeopardize my job if I don't really know what happened behind closed doors, even if I see a trashed room or a bruise. And then people still believe it's a family matter. It's between Amber and Johnny. Let them figure it out. I'm not going to get in the middle. So those are dynamics that happen.
What's the objection?
This right here.
Motion to strike.
What's the objection?
And that's why Amber said what she said. Go on, tell the world, Johnny. See who believes you.
Did you finish your answer?
This is
I
why.
believe so.
Okay. What about mutual abuse? What is that? What role does that play?
So mutual abuse isn't really a term of art that we use. What we look at is situational couple violence and intimate partner violence. And when we look at situational couple violence, that really does characterize the majority of types of violence and abuse that happens in relationships. That's when a couple gets out of hand. They may push, shove, slap, yell, say some things that they don't want. And it's not that those behaviors
I
are
texted
okay,
her to check
but
on
those
her.
are sort
I'll
of
let y'all know what
our
she
larger
says.
scale community-based studies say happens in these relationships. That's distinguished from intimate partner violence, what I'm talking to you about, that has this constellation of symptoms and is rooted in the abuse of power and control.
Is there research that addresses this mutual abuse?
Yeah, there's research that addresses what does gender symmetry look like, male and female, are they the same? And there's certainly, as I said, research that on the lower end types of violent behaviors, push, shove, slap, we may see similar rates between men and women. In psychological aggression, yelling, name calling, putting down, in some of our big community scale studies, we may see similar rates of perpetration in those behaviors. But then there are, other situations where we don't have gender symmetry. And what the research talks about very clearly is you have to examine context. You have to examine the differential of power and control and coercive control in the relationship to make a full determination.
Do women use violence in relationships?
Absolutely. We've known this for 5 decades in our research. We've been studying this since the 70s. And when we look at what happens, women do report their use of violence. The majority of violence that we do see is what we call reactive violence or self-defensive violence, or sometimes violence that's perpetrated independently of an assault, of something that's going on. But mostly that when the partner begins to become violent, then she may become violent and fight back. And that's not an uncommon dynamic, that if somebody is being pushed or shoved or hit, that a person would fight back. That has been established in the research.
And what, if any, effect does that?
And that's
have
what
on
Johnny
changing the
said.
Power dynamics of the structure.
Well, you have to find out, does her use of violence change the overarching power structure of coercive control and violence and abuse in this relationship? And you have to examine those variables to see, does it or does it not?
Can men be victims of intimate partner violence?
Absolutely. Certainly, we know that we have to be careful of gendered stereotypes. We can't go in and think, oh, only the woman.
See,
is
now
the
they're trying to
perpetrator and
refute
only
that.
The man is the perpetrator. That just does not comport with the research. We know that the research also shows that we can have domestic violence in same-sex relationships. My very first case was a same-sex domestic violence homicide in Brooklyn. That was in 1998. So I've been examining and treating individuals in a variety of types of violent contexts. So we have to be careful that bias doesn't get in our way when we're evaluating a particular situation in a particular case.
But see,
That
she's
said,
already
we do know that
exposed
there still are
some
differences.
with the way she
in a
used
heterosexual couple, in a male-female
she and
dyad,
he.
the research still is clear that there are differences. Men still perpetrate more
Exactly.
severe acts of violence. Women are still more likely to be injured. They are much more likely to suffer sexual violence at the hands of their partner. They're more likely to be intimidated, afraid, and they're much more likely to be killed. So we know that those differences exist, but we do examine, in those individual circumstances, knowing that either one could be a perpetrator or a victim.
So how are you able to determine whether a relationship is a situational violence or intimate partner violence?
So I thoroughly examine all of those other variables. I look for the coercive control, who holds the power in the situation, who's able to say no, who makes the decisions, what are the consequences if you don't follow the decisions of your partner? Is there sexual violence? Is there intimidation and fear? Are there statistical factors that are associated with severe and lethal domestic violence? So there's
Obviously,
a lot of
we
data
know
we
that
have in the
men
field that we
are
can
the
use
majority
to assess a particular
perpetrating
relationship
domestic violence.
and really
But that
find out
doesn't
what's
mean
going
that
on.
they're
Is alcohol and substance
the
use
only one. Like, that's
cause people to be
insane
violent?
to try to.
No, it certainly doesn't cause people to be violent. We have plenty of people who can be, struggling with substance abuse and addiction. and
Being
they're not violent.
blindsided by
But when you have a
statistics
substance abuse
is
and
bias.
addiction, and you perpetrate domestic violence, it does create a much more disastrous effect. It is a co-occurring variable, and we know that also from the research that the majority of the women will report that when their partner is
They
drinking,
do.
the
They
physical
also do
violence
that
goes
as
up.
well in
So
reporting.
a lot of the times
sex
when
crimes.
he's physically violent is when he's been consuming drugs or alcohol. When he's not consuming drugs and alcohol and he's not violent, those other behaviors continue to persist. The coercive control, the surveillance.
Why is she
the
talking in
obsessive
generalities
jealousy,
while
the
also
possessiveness,
trying to throw
the
shade?
psychological abuse? Those usually persist, but the alcohol can just throw lighter fluid on a flame in a
Like, are you
situation of
trying?
domestic violence.
I can't.
Is there research that
Okay.
looks at how women cope with the violence and abuse in their relationships?
Yes, there is.
Please tell me about it. What does it say?
So there's been a lot of research to talk about what do women do. That's the question that everyone wants to know. Why doesn't she just leave? And in asking that question, why doesn't she just leave? We actually are able to say, well, let me tell you what she does do. And what the
Right.
research shows is women do a lot of things in that relationship. So sort of three main categories. One are the formal responses, the formal things that she does. Call the police, participate
Instead
in
of saying
prosecution
he,
of your
she,
partner. Go see a
if she wanted to be
therapist, go to a
unbiased, she
shelter,
should have said
go to a hospital.
perpetrator
These
and
are the very
victim
formal strategies
and not
that
associated
women can use.
a
Then
gender.
there are the informal strategies, and that's talking with your
mind
best
games,
friend, talking with your mom,
perception.
talking with your friends, trying to get that emotional support from your social network. But the most common one are these personal strategies. And the personal strategies are really talking with your partner. They're trying to fix the relationship from within the confines of the relationship. Trying to get him to go to
Like I said,
counseling,
if she
try to
wanted
get
to
him
sound
go to
non-biased,
church,
she
try to
should have
get him
said
to
perpetrator and
understand
victim.
his ways, try to get him to get into AA or sober counseling or harm reduction model to help with his addiction, compliance with his demands, anticipating his demands, all these coping strategies that are sort of, embedded within that intimate relationship.
Let's talk about the calling the police. Is that a common response?
It's not a common response. Many women do not want to call the police on their partners. Using criminal justice interventions in crimes of women and children are the least likely to be called into law
Hold on, this
enforcement.
is
And most of
what
the
I do
time
know
when
about.
the police are called, it's because a particular incident has got out of hand and she feels unsafe. And the only way that she feels I can get this incident to end and stop is by calling law enforcement.
And if police are called,
That's fair.
does the woman typically participate in the prosecution?
I mean, this has been a problem and a difficulty for prosecutors across the country since I've been doing this work. I'm actually frequently called by the prosecutor to testify about a fact pattern because the victim won't come in and testify. So dropping
Notice she
restraining
said
orders,
prosecutor.
not participating in the prosecution is a very common dynamic. in
Not, I get called for
situations of
criminal
domestic
cases to talk about
violence,
these.
domestic violence.
I get called for domestic
And what
violent
we
cases,
know and what we know
prosecutor,
from our law enforcement data and colleagues is
trying
that
to insinuate
when
she
you get-
represents
when-
the
When you
victim.
get that 911 call, they're very specifically trained to say, that's likely not the first episode. The chances are there have been more severe episodes before you get this call. So you can't go on the scene and think that this is the first episode of violence. And that's why a thorough assessment is supposed to be done when police officers arrive on the scene. So usually that episode that calls the police is just meant to stop that incident in that moment, to get a sense of safety. But most women don't want to participate and go forward with restraining orders.
That's
Why do women
true.
in violent relationships stay in the relationship when the man's hurting them?
That's true.
I mean, they stay for all the reasons we talked about in the cycle of violence. They stay for the loving man. They stay for the man who's kind. They stay for the man they decided to marry and had hope and promises for
That's
their
correct.
future. So there's a lot of sort of love and attachment is why they're connected to their partner. Some people stay because they have economic reasons.
This
and
is true,
They don't
too.
have tangible resources to leave. Some people have children in common and they don't want to deprive their children of a father. So some people fear retaliation. If I leave, I'm going to get seriously hurt. And frankly, the statistics bear it out. The most dangerous time for a woman is when she's leaving that relationship.
That's
Her
true.
likelihood of being killed grows substantially
That's
at that
true.
moment. So leaving sometimes isn't the best strategy. Staying keeps her safe. So there's usually a whole multitude of factors of why a woman decides to stay in the relationship. And again, as I said previously, it doesn't mean she's unconcerned about the violence. It's just she hasn't figured out a way out yet.
What, if any, role does emotional attachment and love play in that?
That's probably the biggest one, is that you have this, we talked about that trauma bond that has developed, that psychological attachment to your partner. You don't want to leave him. You've connected with him on so many other levels that giving that up just feels like a threat to your integrity. You're just sort of, and a threat to his, because you're just so intertwined and attached.
What, if any, role does hope and optimism play?
Hope and optimism are really what keeps victims alive in these situations. That's what gets them going from one episode to the next, to get up the next day and maybe he's not going to drink today. Maybe it's going to be on his good side. Maybe
This is
he's
all
gonna
true.
Come home and not disappear for 3 days. Continuing to hope
Generally
that
speaking.
some type of change is coming down the pipe.
Now, you mentioned lethality a little earlier. Can you please explain to us what that means?
So lethality is means death, means fatality.
Violated.
And we have
The order of
very
protection.
well validated instruments and data that looks at what factors happen in a relationship where a woman ends up dead. And we do that through looking retrospectively, saying, here's, this person ended up dead, killed by her partner in a homicide. And let's see what factors were there so that we can work at preventing it.
They're
It's very
working hard on that
methodologically
mind
sound
fuck,
over
y'all.
Different cases.
They're working hard on the mind fuck right now.
Over multiple cities, viewed by the FBI and law enforcement. So these are a number of factors that tell us that somebody is in a very dangerous situation. So some of the factors are an increase of frequency and severity of the violence, threats to kill, choking behavior, sexual assault, obsessive and possessive jealousy, controlling behavior, the perpetrator's use and abuse of substances, alcohol and substances, the perpetrator's threatening of suicide himself. Right, those are some of the top
Again,
factors, and there are more.
Substance
that
abuse.
are very, very dangerous.
Though
And
it can
hear
be
that,
prevalent
and hear a
in
woman is
domestic
in a
abuse.
Situation where those are present, then we are moving out of a situation
Does
of
not
violence.
mean
What,
that
if any, role
someone
does destroying
with the
property-
substance abuse
And destroying
is
property,
abusive. They're
destruction
not
of
mutually
property,
exclusive.
Personal property is also one of the risk factors for danger and fatality.
And what, if any, role does leaving threatening messages play?
That's also a risk factor for lethality.
What are the psychological and traumatic effects that such interpersonal violence has on victims?
Objection compounds.
Psychological and traumatic effects are kind of interchangeable.
sustain the objection.
What are the psychological effects that such interpersonal violence has on victims?
So these have also been well researched, and they are wide and varied. We see depression and depressive disorders, sometimes with suicidality. We see anxiety and anxiety disorders, a lot of stress. We see post-traumatic stress disorder. We see substance abuse and substance abuse disorders. We see trust difficulties and difficulties in interpersonal relationships. As a result, we see a lot of shame and humiliation. We see anger and rage, a whole sleep disruption, a whole host of difficult psychological consequences having sustained a relationship of intimate partner violence.
They ain't worried.
World is low self-esteem.
They're like, let her talk.
Well, low self-esteem is a very common after effect, and that, you know, when you're embedded in the relationship, it also makes it just very difficult for you to climb your way out.
What is emotional dysregulation?
Emotional dysregulation, so it's a DYS, dysregulation, is when you sort of don't feel that you have control of your emotions. You
Absolutely.
feel like you're fluctuating, you know, from one to the X.
They're
one to
connecting with the
next.
jury,
It's not the
likability,
same as a
believability.
bipolar disorder, you know, can happen in short moments that, you know, it's really because your central nervous system is so out of haywire from being exposed to so many traumatic events that you may feel things deeply and with a short trigger in a very quick time.
In your experience, is there a particular way victims of intimate partner violence remember the violence they endured?
Well, memory for traumatic events is something that has been well researched. Sometimes people have what we call
I wish.
dissociative amnesia, where because of the physical or psychic pain of what they're going through, a portion of the memory either gets blocked or can't get retrieved. Whether it's stored or retrieval, we're not really sure. But most of the times, the memory is really about when you have multiple repeated events of the same type of thing. So if you are abused multiple times and the abuse is very similar, it's very common for the victim to lose discrete details of a particular incident. They may not retain the memory for the complete incident, and that might not be.
The more we talk in generalities, the more we distract.
Because you have so
We can
many
hit on those
common
emotional and
events,
mental
that
ploys.
happen to you.
Are there common myths
You
or
know?
misperceptions about domestic violence?
There are. I hope I've dispelled some of them here already, but I mean, the myths, you know,
I
certainly
think
are
you
that
proved
women are
some
meek,
here
are
instead of
passive,
dispelling them, but
are,
all
you know,
right.
just sitting there and letting the abuse happen, that women don't fight back, that women don't yell back, that some old ones, that they like the violence, they're not concerned about the violence, that if it was really bad, she really would have left. If it was really bad, she really would have told the police. All of those myths and misconceptions that just don't comport with the research.
Are there also myths about trauma survivors? What house trauma survivors?
Anyone that knows
present?
about domestic
Yes, there
violence
are,
is not
and
going to
what we
ask
say
those
is,
questions.
you know, how lay people think someone who suffered a traumatic event is supposed to act. So in the immediate aftermath of a trauma, people think, oh, they should be hysterical and abreacting and emotional all over the place. And that's typically not the first reaction of a trauma survivor. The first reaction is, you know, suppression, emotional numbing, emotional constriction. How do I get through this? You know, women who are beaten, they get up the next morning, they get their kids dressed, they get them to school, they go to work, they do a presentation in their office, they go on with life. The most normal thing that a person does who's experienced trauma is to get up and try to be normal. They're striving for that all the time. So sometimes if you see somebody who is more emotionally constricted,
So you
looks
wouldn't be
maybe
getting in an
stoic, looks
elevator
like they're not
that you know
feeling,
has security
it doesn't
cameras
mean
with
that
another
they're
man?
not having internal reactions. We say this in the field of clinical psychology all the time. The inside doesn't match the outside. What you're seeing on the outside may not match what's going on for the person inside, because they have to be so controlled, because the fear is that if I let out a little of this emotion, I'm not going to be able to put the floodgates back on. It's just going to be too overwhelming. And that's true for people who are involved in litigation, and also true for my private patients who are, even though they're coming to me for help, they try very, very cleverly to not want to feel the difficult emotions of the trauma that they experienced.
And is it also possible that they can look very friendly and smile and laugh and things like that?
Yeah,
Yeah.
Some compounds.
Sustain.
What, if any, please describe some of the ways that a victim can hide that, as you just testified to.
We call that the appearance of normalcy. the appearance of competency, right? And it doesn't mean that they're not. It doesn't mean that they're not normal and that they're not competent, but it doesn't give you a bird's eye into their inner experience. And that's what we do in the rooms of therapy, where we really help people deal with that they keep to themselves. But yes, someone can be smiling and happy. It doesn't mean that they're not suffering inside.
Is there a single profile that fits all women in domestic violence situations?
No,
Is there a single profile of a man who perpetrates intimate partner violence?
no.
Your Honor, I'm at a point of moving to a new topic area. I don't know what Your Honor wants to do because I know we switched the lunch hour. I'm perfectly happy to keep going, but if this was a good stopping point, we could make that for the break.
All right, let's go ahead and take our afternoon break for 15 minutes, okay? Just do not discuss the case and do not do any outside research, okay?
Okay, it's time for a team huddle.
All right, and Dr. Hughes, since you are testifying, please do not discuss your testimony, including the attorneys at this point, okay?
Yes.
All right, we'll come back at 3:15 then, okay?
Thank you, Your Honor.
Okay, group sidebar, let's go. I think that it would have been better had she said, with the perpetrator and the victim in these scenarios instead of she, he. That showed gender bias. Now, of course, we know that statistics show that, yes, the majority of people perpetrating this crime are men against women, but you cannot let that blind you from knowing that you can have male on male, female on female, female on male. I mean, that's crazy. And she's spoken nothing but generalities the entire fucking time. I mean, perception is everything. And she was playing the mind games with that one. I mean, she really was. The more she goes into these generalities, they're hoping that it will target people's emotional, mental, and personal feelings and knowledge, people that they know, experiences that they've had, and that she can reel them in that way. But nothing she said, she just spoke in generalities. I mean, she threw some things in there without context that made it look as if it applied to this case, but she just got up there and talked straight up generalities about domestic violence. She made statements that are very true. I just don't know that they apply to this case. That's a mind game. That's intentional. Like, you have to keep in mind, so they will be playing the perception game. And you saw this when Depp went, right? And this is one thing that I called them out on beforehand. Both sides are going to pull clips and pull things and edit them so that it presents better for their case. Okay, like that's going to happen in every single case. Okay, fine. But when you can play something in its totality and then pick it apart to be better for your case, that's the way to go. And they got caught. They took a statement, had the guy read only one line of it, knowing that they had redirect coming, where then they made him read the entire statement, and it made them look crazy. It made them look like they were going to try to deceive you. Now, of course, both sides are going to manipulate things that's best for their case, but they literally got caught doing it on something that was completely irrelevant. And if they caught on to that, they should be catching on to what's about to go down here. What do y'all think? Just me going on a side rant here? Talking to the jury is you do that. You want to like build a rapport with them, connect with them. It helps with likability, believability. Witnesses should always try to look at the jury and who's questioning them, make eye contact. I think having more men on the jury will play in Deb's favor. Surely to God, she has to get more specific. She has to. Right now, what they're trying to do is implant these ideas into your head that explain or might rationalize some of the behaviors that have been discussed to this point, and drop a little seedling into your head that these things that you've seen can be explained away with what I just explained. That's what they're hoping for here. Lacking context, but that's beside the point. We also have to acknowledge our own bias, right? Like we're all Team Depp, but if we were Team Heard, that's the thing about the op-ed. The op-ed discussed so many things that were relatable, very important, very real, and emotional. And what she just discussed basically was all of the emotional ploys that were throughout the op-ed, in my personal opinion. This is true too. So like with the finances, for example, yes, if there's someone that controls the finances and you're not allowed to buy anything, you've got no control when to buy something, you have to ask permission to buy something because you might get yelled at, obviously that is a form of control and abuse. However, if someone has their own set of money and someone has their own set of money and they have their own bank accounts, like context matters. We don't know what their financial situation was, other than the fact that it sounded like, from what he said and from what his accountant said, that he pretty much took care of Amber and all of her friends. I mean, that's literally what everyone said. So it doesn't look like he kept her. Even when they were in an argument, he said she wanted to go stay at some expensive hotel. And even though they were in an argument, he paid for it because he didn't want her to pay for it. And y'all know she's got her own money. I can go off on some side rants. I would do it more, but I don't want to talk over them when they're talking. I'm with you. I really think she should have said the perpetrator and the victim instead of she. And then it's like she caught herself. Now see, let's see who noticed this. It was she, he instead of perpetrator and victim. And if you noticed, then she brings up a same-sex couple. Like it's like she caught herself being biased in her presentation, or maybe we'll give her the benefit of the doubt. Maybe she wasn't being biased, but she realized that what she was saying could have been interpreted as bias. So then she throws in a same-sex couple and then goes back to her bias. I mean, how hard is it to say perpetrator and victim versus she and he? But obviously she's intending to say that. Don't know what happened. Sorry. I wasn't the only one that noticed that. Okay, good. Good. I mean, I'm going to be real with y'all. She can't be that fucking scared when she got on that elevator with cameras in it, not worried about it. That's just my personal opinion. Yes, I mean, but see, when Curry spoke in general terms, she talked about general terms as far as what she was about to be discussing. And then she went into detail, like you said. She just went through all, like, I'm wondering just how far down this rabbit hole they're about to try to throw Johnny. Because she just went into every form of, I mean, just shy of every form of domestic abuse and sexual abuse. She just went way down the rabbit hole. So if she's speaking in generalities to then flip the script and get very specific, I mean, they're really about to do the most here. What pisses me off about this whole thing is that there are real victims, and if she's lying, then she is ruining the credibility and all of the hard work that victims have put into actually being heard and believed. I mean, it's not cool. This is a yes. I feel like the comment section is so wise. Like, I'm honored by how wise this comment section is because I am seeing critical thinking. I love it. I love to see critical thinking. Oh. Now that is an interesting little tidbit. Okay, well, here we go. Oh. I think Cross will be very interesting. Notice they're not worried about it. They're like, let her, like, they put in a compound objection, another compound objection. I can't remember, but there was another one, but they're not worried about it. And that's the thing about expert witnesses, and I talked about this in one of my YouTube videos, was there's a bias attached to an expert witness. There just is. But it sucks because there's times when maybe the good guy, the supposed to be good guys or the bad guys, or they got it wrong, and here's somebody with the defense really telling the truth, but you associate them with being paid to be pro-defense, so you don't believe them. Also, I don't know if y'all caught this, but what I was trying to say was she made sure to say, she didn't say I get called in criminal cases to testify about patterns of behavior. She said I get called by the prosecution in criminal cases. That is insinuating that she gets called to help victims. I don't know if y'all, it's all about word games, baby. all about the word games. Hey, I'm an Arkansas lady myself. As Arkansans, we don't get enough credit, I swear. Hey, I swear, common sense is not that common anymore, but common sense and critical thinking will go a long way. And that's why I'm always trying to check my bias too. Like, okay, well, what can I say about the other side? If I was the other side, like, why did they think the way they think so that I can better my way of thinking? Or if I need to change teams, then I'll change teams. But you have to know both sides and think about both sides in order to know, are you on the right side? Do you need to switch? Or what can you do to better your argument to make it more understandable? And so I just love to see it. They're on break right now. They'll be back in just a minute, just stretching their legs, going to the bathroom. Agree. It's been very informative. A lot of what she said has been accurate. I mean, I wish she'd been a little less gender biased in saying it. Like, look, we know that the majority of the gender perpetrating domestic violence from statistics is men. But if she's wanting to not seem biased, she should have been speaking perpetrator and victim instead of she, he. But yeah, she was very informative and right about a lot of what she was saying. It's just, yeah, it was generalities and it wasn't specific to this case. But again, mind games and perception. She was digging that damn hole, all right. She had literally had the tractor out there digging that shit. I think Cross is going to be good. Leading objection, Derek.
All right. Are we ready for the jury?
Yes, ma'am.
Okay.
Oh yeah, there were a few leading objections, which is like leading to the answer. You know, like you're insinuating what the answer should be. That's objection leading. Asking them what they make is to show bias. I get why they do that. That happens a lot. It's just, her attorneys kind of played it off like a little dick move.
All right. Be seated. All right. Your next question.
Thank you, Ron. Dr. Hughes, did there come a time when you conducted a forensic psychological evaluation of Amber Heard? And please tell the jury what a forensic psychological evaluation is.
That's
Can you turn it
interesting.
on at the bottom base.
A forensic psychological evaluation is an evaluation that is conducted for courts to answer a particular legal question. It contains multiple parts. Ms. Heard is not a client of mine. She's never been in therapy with me. She's not under my clinical care. It is an objective evaluation to determine a particular legal question.
Well, there you go,
Forensic
folks.
evaluation
There you go.
follows a methodology that
Hot
we
damn.
say it's a multi-method multi-hypothesis driven methodology, which means I look at a variety of different documents and data using multiple hypotheses. It's not just one hypothesis, one theory of the case. You're going in looking to see, what possibly could be going on here. And then you use the data to arrive at that opinion. You look for consistency across the data to arrive at that opinion. And the forensic psychological
Imagine that.
evaluation has many parts. It has the clinical interview part, a structured or semi-structured clinical interview where I'm asking Ms. Heard lots of things about her life, both before Mr. Depp and after. It involves a psychological testing component of the evaluation, which allows me to do a good broad scan of different symptomatologies that people might have in their lives, as
Damn.
well as to have indicators of how she approached the test. Is she defensive? Is she malingering? Is she feigning? Is she exaggerating? It gives me indications about how she approached the evaluation. I review a number of documents, medical records, psychological records, the text, the audio. All
I
the
think she
different
said
things that
she's
we've
not
had
her
in this
patient.
case. And
Did
then
y'all
I
hear
conduct
that?
collateral interviews.
I heard her say that she's not her patient.
Dr. Hughes, do you, just to be clear, do you assume everything the victim reports is true
Yeah.
when you conduct these examinations?
No, of course not. I always approach a forensic evaluation with a healthy dose of skepticism. With any forensic evaluation, there exists a motivation that the individual may be telling you something that is not accurate. It doesn't mean that that's there, but you have to control for that and know that you're looking for, again, what does the data tell you, the external data, about what the person is also telling you.
Did the forensic
How it should be.
evaluation follow a standard methodology, or was it specific to Ms. Heard?
No, this was my standard methodology that I would use with any individual who's in a forensic matter, and I was called to evaluate them.
When did you meet with Amber Heard?
Okay, so I met with Ms. Heard for a total of about 29 hours. I met with her for the first time in September 2019. I saw her for 4 visits in live in my New York City office. That's about 22 hours. And then I saw her twice over Zoom. One was in January 2021 and
Approach, okay.
Okay, so yeah, she said that she never treated her. She wasn't her client. I'm wondering if they handed her documentation to objectively review what's on the documentation and then give her professional opinion on just the paperwork. But then now she's saying she met with her. So now I don't know. I swear she said that she was not her patient and just objectively reviewing, which to me would be like, okay, Amber's team provided her with documentation and she's reviewing that documentation to make her opinion. Fine, fair. But now what?
Dr. Curry, in answering that question, were you consulting anything?
Dr. Hughes.
Dr. I'm so sorry.
So they just caught it too, yeah.
Dr. Hughes, were you consulting anything? Dr. Curry's here, I guess, as well. That's the confusion I saw.
I'm consulting my cheat sheet of the dates that I saw Ms. Heard so that I could accurately report to the court. I also have my final designation in front of me so that I could give the most accurate information to what I put in that report.
Okay. And do you want to see that? Okay. Should we just take the break now and have him look at it, or does he?
Would you like to look at it now or before crossing?
It's just a post-it.
Okay, before crossing.
Okay,
All right,
that's
that's
fine.
fine, thank you.
Okay. Please continue. I think you were telling us when you saw Ms. Heard.
Sure. So there were 4 dates
Me
in
too.
person in New York City for a total of about 21 and a half hours. And then I saw her in January 18th, 2021 over Zoom for 3 hours, and then December 27th, 2021.
Good, they
for 4
should.
hours over
That was
Zoom.
bullshit.
And what did the evaluation consist of?
So as I stated, the evaluation consisted of psychological testing, a semi-structured clinical interview with Ms. Hurd, a review of a whole host of documents relative to this case and medical records and psychological records, and then 3 collateral interviews, 2 with her treating therapist, Dr. Bonnie Jacobs, Dr. Connell Cohen, and also with her mom.
And in the semi-structured clinical interview, what were you
No,
assessing?
Well, when someone comes in for the evaluation, you sometimes don't know what you're going to see or what you're going to get. So you absolutely have to do a full clinical interview and have a sense of their life patterns, things that have affected them in their lives, where they have worked, where they have lived, just get a full sense of their sort of being before the incident for which they're talking about. Then I do a full intimate partner violence assessment, looking at all those characteristics that I talked to you about earlier to get a sense of the full structure of and
she
the
could be
dynamic
a
of this
rebuttal
relationship.
witness.
I also did looking at what were the effects, what were the psychological consequences of being in that relationship. And I also looked at the psychological consequences of some of the statements that were made by Mr. Depp through his attorney that are part of this, the counterclaim in this lawsuit.
At the end of that process, considering all the data, did you arrive at any expert opinions?
Yes, I did.
All right, I'd like to start with your main expert opinions and then go through those. Can you please tell the jury what your main opinions were?
So like I said, there are opinions embedded within them, but the main opinion is that Ms. Hurd's report of intimate partner violence and the records that I reviewed is consistent with what we know in the field about intimate partner violence.
A medical person will have to
Characterized by
sort
physical
that out.
violence,
I don't know.
Psychological aggression, sexual violence, coercive control, and surveillance behaviors.
And what was the other main opinion that you had?
The second main opinion was that that Ms. Hurd demonstrated very clear psychological and traumatic effects or the exacerbation of trauma from those statements that Mr. Depp made through his attorney. There were 3 statements that we evaluated to see how they affected her emotionally and psychologically. And it was my determination that they did.
And did you arrive at any diagnostic conclusions?
Yes, I did.
And what were those?
I diagnosed Ms. Hurd with post-traumatic stress disorder.
And what, if any, etiology was associated with the post-traumatic stress disorder?
So the etiology is the cause. In order to meet criteria for post-traumatic stress disorder, you have to have an actual cause. It's one of the few diagnoses.
My face is very
diagnostic
expressive.
entities that we have to have a cause for. And the cause was the intimate partner violence by Mr. Depp. That was what was pushing the symptoms. That was what's related to the intrusive phenomena. That was related to her avoidance. That was related to her differences in her mood. That was related to her avoidance efforts. So it was the cause was the intimate partner violence by Mr. Depp.
Now, let's first go back to the forensic evaluation. You mentioned you reviewed documents. What documents did you review?
So I'm going to refer to my list of documents so that I can be clear for you all.
I'm
It is
confused.
a 4-page.
Sorry.
Did she just review documentation and verify it to make an opinion or what? I'm just a little confused about what exactly she did. Because, yeah, I mean, if they gave her documentation and she's supposed to look at all of those records and make a non-biased opinion based on those records, great. I'm not a medical person. I don't know. That's not my realm. I don't know. If you don't treat someone but you're evaluating them, does that make them technically a patient? I don't know. If evaluating someone but not treating them, I don't, we need a medical person to hell the fuck. Oh, hold on, I'm trying to block somebody. Block the fuck. Okay, sorry. Yeah, I don't. She was accepted as an expert witness. Okay, it does not make them a patient if they evaluate but don't treat, it does make them a patient? I love it. I love it because I do the hand gestures too. Penny's like, what the fuck, lady? Like, what the? Oh my God, you got the squint eyes? Okay, so answer. If you're evaluating, here we go. Oh, I tried to click. I only got confused because then she said she met with her for several hours. That threw me. But again, medical's not my thing. I don't know shit about fuck.
Dr. Curry, if you, I mean, Dr.
Dr.
Hughes,
Hughes.
I don't know why I
Oy.
said that. My apologies. Dr. Hughes. I think it's the confusion of having her in the courtroom. Dr. Hughes, if you need to consult your notes to answer something, let us know that.
Well, can
need
you
to consult
can you
your
help
notes.
us out? Because we're on the fucking
Otherwise,
struggle
Try
bus.
to answer to the best of your ability. And then if you need to do that, just let us know you're consulting your notes, okay? The concern is that you not read from them, that you.
So she's
consult
never
them as you
treated
need to,
her.
Okay?
She just looked at the
Correct, I just don't want
documentation
this to
and then
be a
met her in
memory test
person.
of having conducted many documents, 80 pages of notes,
But you
and 12
can-
psychological testings to,
You can reference your notes, just don't read from them, okay?
yeah, no problem.
Okay, great. So please tell us what documents you reviewed. Please tell the jury.
Okay, so I reviewed a number of documents, a plethora of documents, most, and I obviously won't read them all, but I reviewed certainly all of Ms. Hurd's testimony that she gave in her deposition testimony in this case, her deposition or her trial testimony in the UK case. I did the same thing from Mr. Depp. I reviewed his deposition testimony as well as his trial testimony in the UK as well. I reviewed a number of the depositions that were put forth in this case. I reviewed the psychological treatment notes for Dr. Bonnie Jacobs, Dr. Connell Cohen, Dr. Laurel Anderson, and Dr. Amy Banks, although she did not have treatment records. So I reviewed not only their records,
She wishes.
did collateral interviews with some of them, and also read their deposition testimony, and also read other medical records in this case, nursing notes in this case, in the highlights. And I also listened to the audios that were put forth in this case and read the text messages and emails.
And what, if anything, did you do with respect to any videos?
And I also saw the video in the kitchen. Yes.
Is that the
No.
only video you saw?
The collateral interviews that you conducted, why did you conduct those?
Well, collateral interviews is a standard part of a forensic evaluation. It's an opportunity to hear from another treating clinician, the person who's actually treating the individual you're evaluating, and get a better sense from that person of what they saw, what they
Did we
knew,
put
how
eyes on
they
Curry?
experienced this person. Sometimes our clinical notes don't give the full breadth of what really was going on in that therapy, because the notes are meant to be sort of short and to the point of what happened, who was there, and what was the plan. So it was really helpful to talk to these two clinicians who really were with Ms. Hurd throughout the duration of her relationship with Mr. Depp. So they gave us sort of a contemporaneous look at what was going on for her emotionally, and then what was she reporting, what was she saying about the relationship to her therapist.
And you mentioned the name Dr. Bonnie Jacobs. Please tell the jury who Dr. Bonnie Jacobs is.
So Dr. Bonnie Jacobs was.
I wonder if she is
Ms. Hurd's
listening, though.
therapist, and May I refresh my recollection with my notes, Your Honor?
She's allowed to
For the
consult your
dates,
notes.
if you'd like me to tell the dates?
I think Penny
Yes, you
knows
may.
what she's
Okay,
allowed to
yes,
do.
right, you're right, yes.
May I?
Yes, you may consult your notes, yes.
Objection, Your Honor. Can we be here?
Oh my God, this is us when we have sidebars. When we have team huddles, this is us. Fucking hysterical. Turn away from the camera so that you can laugh. Yeah, I don't know. I still don't know. I mean, I guess she never treated her. She evaluated paperwork and then she met with her for 29 hours. I'm still not clear on that. Her calling her Dr. Curry is fucking hysterical. Like, as if she wishes. I did wonder if Dr. Curry was in the courtroom listening. But if Curry was an expert witness, she should be allowed to hear other expert testimony so that she knows how to, like, if they call her up on rebuttal, she has to know what she's correcting. And usually experts give the team they're working for notes on what to.
Go ahead.
Oh, thank you.
I'll shut up now.
So she treated with Dr. Bonnie Jacobs, who is a psychologist, from October 2011 through August 2014. She actually was seeing Dr. Jacobs somewhat earlier before she got in the relationship with Mr.
There's a
Depp.
lot of sidebars going on.
And then she transferred care to Dr. Connell Cohen, who was referred by Dr. Kipper, who was the treating physician for Mr. Depp, and then later for Miss Heard. And she treated with Dr. Cohen from after she left Dr. Bonnie Jacobs in September 2014 to June 7th, 2016.
Okay, thank you. And so and I guess you got ahead of me there, so you also talked to Dr. Cohen, correct?
That's correct.
Okay. And you also spoke with Paige Heard, did you say?
That's correct.
And who is Paige Heard?
Paige Heard is Amber Heard's mother.
Who's now
And
deceased,
when did you
just
speak
for
with
context.
Paige Heard?
I spoke with all of these individuals at the end of 2019. Again, I can check my notes and let you know the exact date if you'd like.
I think the end of 19.
Yeah, they all were
2019
in
is
the
fine.
end of 19,
All
yes.
right. And
Let me look up
you,
something about Virginia
are you
law real
aware
quick.
that
Hold on.
Paige Heard has since died. She died 2 years ago.
Yes, I am aware, sadly.
Okay. Now, let's talk about the psychological testing. You stated that you conducted psychological testing, is that correct?
That is correct.
Can you
Gotta look something up. Hold on.
please tell the jury how many psychological assessments you administered to Amber Heard?
I administered 12.
Can you please tell the jury which ones you administered?
So I am going to refer to my designation that has the list so that I don't forget anything.
I don't think she can mention anything that paid with Paige since Paige is deceased and can't like correct. I mean, it'd be hearsay anyways, but well,
So
she's an
I
expert.
administered,
Objection, hearsay, Your Honor.
She can refresh her recollection.
As long as she's not reading it.
But
Right, you
if
just can't read, that, you're not supposed to read from it, but you can refresh your recollection as you're speaking.
so I can look and just look up and that's refreshing my recollection. Okay.
All right.
Oh, shit. Oh shit. Okay, so she just showed attitude against the attorney that she's literally being questioned by. That was not good. That attitude she just showed was like, I can't, you know what I mean? Just say like, I don't know. I can't see. I'd have to check my notes like everyone else has fucking said. Literally, Dr. Curry, all the other doctors, I'd have to check my notes. Well, if that's what my notes say. I mean, that was. Yeah, I'd been going over that shit before I came. Just because I knew it was on TV. I would have been looking at that. What I was trying to look at, she shouldn't, first off, Paige is dead, so you can't just throw in stuff with Paige because she's not around any longer to refute it.
The tests that you administered.
Yes, I can. I administered the personality assessment inventory, which is a broadband instrument to scan for psychopathology and psychological symptoms that people have. I administered the trauma symptom inventory too, which is an instrument to scan for common traumatic effects that people have. I administered the Miller Forensic Assessment of Symptoms test, which is a measure of malingering. I administered the post-traumatic stress disorder checklist for the 5th edition for the DSM-5.
Paige
I
is
administered
Amber
the
and
push
Whitney's
clinician
mother, who
administered
passed away.
PTSD scale for DSM-5. I administered the Beck Depression Inventory, the Beck Anxiety Inventory, the Mood Disorders Questionnaire, the Danger, I did 3 intimate partner violence measures, the Conflict Tactics Scale, the Abusive Behavior Observation Checklist, and the Danger Assessment Scale. And then I also did the Life Events Checklist, which scans and gets us to ask about a lot of traumatic events that an individual may have experienced. And we administer that typically before either doing the PCL or doing the CAPS.
Thank you. Were there any tests you administered to Amber Heard that were designed to reveal malingering or feigning?
I think that's
Yes,
why
there
she warned her, like, you
Can
know,
please
Paige
tell the
died,
jury
right?
about those?
So malingering is the false production of psychological symptomatology
Make it make
for the
sense.
purpose of some external material gain. Feigning is the false production of psychological symptomatology with no identification of what that gain may be. So basically feigning is saying your mental health is worse than it actually is. So I administered 3 of the tests had validity indices built in that could allow us to address that question. The MFAS, the Miller Assessment, a Forensic Assessment of Symptoms test, is a specific malingering instrument. It looks at malingering psychopathology. Is this someone, malingering psychopathology? She scored a 0 on that scale. So on that test, sorry, not the scale, that test. So on that test, there was no evidence of malingering. On the TSI, there are 2 validity indices, and she scored within the normal range on those scores as well. One was slightly elevated, but when in testing the limits, because it has rare symptoms and over-endorsed symptoms, I determined that also was a valid measure. And then finally, the PAI, the large scale 344 question instrument, has very robust validity scales on it to test for exaggeration or feigning or malingering. And she did not score in any of those scores and those scales at all. Those were not elevated. So the combined results between those 3 tests suggest to me that Ms. Heard is not malingering for psychological symptomatology.
Now, Dr. Curry testified that one test showed, quote, intentional exaggeration in the 98th percentile, meaning that she engaged in extreme levels of exaggeration, end of quote. Do you agree with that?
I do not.
Why?
Because that test, the scale that she is referring to it's called ATR. It's the atypical response scale. As I said, that combines rare symptoms and over-endorsed symptoms. It's very frequently elevated in people who have high levels of distress. And then importantly, on this test specifically, it says, do not use the percentile rank. It is in the manual, it is in italics, because the way that this test was normed, it was normed on people who have trauma. So it's what we call negatively skewed. That means it falls on the tail end of the continuum. It is not a normal curve where we would normally think of how a percentile would work. So you would not use the percentile rank on this test.
You want to approach?
Yes, please.
Okay.
When you have to have a sidebar instead of just objecting every single time. Jesus bless. What the fuck are we watching? She's trying to shade Dr. Curry, y'all, so we need to go back and rewatch that and Take notes.
So that is a very inaccurate way to describe that scale and that test. The ATR scale on this test is probably the least robust of our validity scales. So you would never make a comment like that based on one scale if you don't have consistency across data. And when you look at the consistency across the testing with the PAI, the TSI, and the MFAS, and there's research to support that when they go together, you have a higher degree of likelihood that this is not feigned PTSD, that this is not feigned symptomatology. And then actually, if I look at the validity scores on the MMPI-2 that Dr. Curry administered, those scales are not elevated for exaggeration or malingering either. So if I add that, now I have really robust data that Ms. Hurd is not malingering or feigning her psychological symptomatology.
Thank you. Did you administer any tests that are specific to domestic violence?
Yes, I did.
Which ones?
So that was the conflict tactic scale, the abusive behavior observation checklist, and the danger assessment scale.
And what did they show?
We'd like to refer to the testing.
To refresh
To
your
refresh my
recollection?
recollection, just a glance so I
Yes,
can
you may do
be
that.
clear with the jury.
They're saying, "Don't laugh, you son of a bitch." We're fighting for our lives not to laugh. You cannot
So
fucking laugh.
what the overall
Get it together.
gist of the testing was that and the benefit of these tests is that they allow me to ask for what Mr. Depp did to Ms. Hurd and then also what Ms. Hurd did to Mr. Depp. So it was asking about both sets of behavior. And what the-
Objection, Your Honor.
Let's hear it.
We're back to reading.
She wasn't even looking down. She was looking at the jury.
Bro, she literally had her glasses on. Let's not lie about it.
Go ahead.
Please continue.
So what these tests show was that there was a high degree of serious violence perpetrated by Mr. Depp toward Ms. Hurd. There was violence more on the mild level perpetrated by Ms. Hurd toward Mr. Depp, with one severe indicator, which was the punching that she indicated to me. There were scales about negotiation, about how much this couple tries to figure out their problems. They both scored, again, this is Ms. Hurd reporting that, but they both scored in the high range where they're both saying that, yes, we're trying to figure this out. We're trying to work out this relationship. There were scores on the psychological aggression scale where Mr. Depp engaged in more severe acts of psychological aggression, whereas Ms. Hurd did engage in also some mild and severe acts of psychological aggression. The amount of injury that was reported was significantly higher and more severe by Ms. Hurd, what she was subjected to. And then she was subjected to sexual violence where Mr. Depp, based on her report, was subjected to none. And then the other, on the danger assessment scale, that there were a number of factors that were related to severity in violent relationships and a risk factor. When we look, as I said earlier, when behaviors come up on this scale, they're very worrisome, very scary, and we have to take them seriously. So there were a number of behaviors that came up on this scale, such as Mr. Depp threatens to kill her, the increase in severity of the abuse, the forced sexual activity, the choking behavior, his obsessive jealousy.
Objection, subjection.
Yes. Are you asking these? Yes, absolutely. Are you? I was just about to say. Are you asking these questions or stating them as?
Please continue.
These
The
are things that
obsessive
he did.
jealousy, the control aspect, and his threatening of suicide to kill himself. So those were risk factors that
I feel you,
placed her
Johnny.
in
What the fuck?
increased danger range. And this is a range that, says that we certainly have to advise women of their risk and consult with
Like, were these general questions or
law
these like
enforcement if they're
I'm?
involved, or judges if they're involved, because this means that a woman is at risk for more serious or lethal
All right.
domestic
Okay.
violence.
So did the results of the psychological tests you administered to Amber Heard support a diagnosis of PTSD?
Objection, leading.
What, if any, psychological tests did you administer?
She knew that would
supported
be
the
that.
diagnosis of PTSD for Amber Heard?
Sure. So there were 4 tests that supported that diagnosis. One was the PAI, which was that 344 question large scale personality inventory. On that test, her largest subscale, her highest subscale was the one that measures traumatic stress. So that was clinically significant. On the TSI, 2 of her scales were the intrusive experiences dimension and the defensive avoidance dimension, 2 of the classic scales of trauma and PTSD. On the PCL, which is the post-traumatic stress disorder checklist 5, that she scored in all 4 domains of PTSD, and that's an instrument that says how much are you bothered by these symptoms, and in all 4 clusters, which would be the intrusive experiencing, when things about the abuse or the trauma enter your mind when you did not want them to. Sometimes they're cued, sometimes they're uncued. She answered in the avoidance category, which is the second category of PTSD, that I do things to try not to think about this, to try not to feel this, to try not to get upset. Sometimes I avoid certain people because they become a trigger for me. She scored in the what we call the negative alterations in cognition and mood, changes in her thoughts and feelings as a result of the abuse and trauma, and also in the physiological hyperactivity, the hyperarousal, the hypervigilance, the startle response. So on the PCL, she endorsed symptoms in all 4 of those categories, saying, some of these symptoms are bothering me a lot. And then finally, the
Yeah,
clinician
Curry would say I would have to
administered,
refer to my notes if that's what my notes
PTSD
said.
scale for
That's what
the
they've all
DSM-5.
said.
And what that allows me to do, unlike the PCL, is really look at symptom severity and symptom frequency. How is this really playing out for this individual? And similarly, she scored in all 4 categories of trauma and of having intrusive experiences and nightmares and avoidance efforts and physiological hyperactivity and changes in her mood and her thoughts. And her total score was a 28,
Great
which
question.
falls in the moderate range. So that means that she has experiencing a moderate degree of post-traumatic stress disorder symptomatology. And those tests,
Of course, those
allow them
questions
with that
sound like
definitive diagnosis that she
they were
suffers from
tailored to him.
PTSD.
which is kind of
Thank you.
ironic considering
What
how did
any
she verify
consideration
that?
Did you give to Amber Heard's history of childhood abuse in making your diagnosis?
I mean, that was a significant consideration given that we know that childhood, well, first of all, we know that people can experience multiple traumas across the lifespan. And we wanted to make sure that the symptoms that she was experiencing were related to what she experienced with Mr. Depp and not her childhood. And certainly, earlier on in the evaluation, and when I evaluated and spoke with her, that was true. And that was also true on the latest measure, the clinician administered PTSD scale for DSM-5, the CAPS-5. And that's because the content, you have to look at what is the content of the symptom. So it's not that someone says, oh yeah, something traumatic comes into my mind. No, what is it? What comes into your mind? What bothers you? What are the triggers? And those were all specific to Miss Heard's relationship with Mr. Depp. The reason the childhood is also significant is that we know that if somebody suffers childhood abuse as a child, they are much more likely to have an adult re-victimization. And they're much more likely then to be more vulnerable to obtaining a PTSD, to getting PTSD if they've had that prior vulnerability. So it's a very strong vulnerability characteristic to obtaining PTSD when you have a subsequent trauma. The other aspect about her childhood abuse is that she was raised in a family of violence. She was physically abused by her father. She saw her father abuse her mother. Her father was very explosive and had violent outbursts. And both her parents also struggled with substance abuse very significantly. So she had learned from a very early age how to caretake.
Can we verify
How to
that?
live in a situation that is mired in chaos. How do I take care of a parent who's passed out, knotted out from heroin? And how do I get up and get
Oh,
my
she
sister
just
to
straight up
school?
just said,
She
fuck
learned
it, throw
at a
him under
very
the
early
bus.
age that she had to figure out how
Okay.
to do this in this scenario.
Mom's dead,
And I
let's
would
call
say
her a heroin
lastly,
addict.
what that
The fuck?
environment taught her was that She learned
That was
she
not
could love
necessary.
someone who hurts her. She knew that people who hurt her also can love her. And she learned how to have this tolerance for cognitive inconsistency, this tolerance for two should be diametrically opposed emotions. But she grew up knowing or believing perhaps that this could happen. And she also believed that she could fix him, just like she tried to fix her father and just like she tried to fix her mother. She truly, truly believed that she could fix Mr. Depp and rid him of his substance abuse problems. But that did not work.
Did you review Dr. Curry's CAPS 5 that she administered to Amber Heard?
Yes, I did.
And what, if any, agreement did you have with Dr. Curry's interpretation of the CAPS 5?
That was dirty.
I didn't agree with her interpretation, having
That was
been a
fucking
trauma
dirty.
psychologist for over 25 years and administered hundreds of these. I found that there were flaws in how she chose to administer it. And then
She
some
could have
of the
said
coding.
addict. She didn't have to throw her under the
Ms.
bus like
Heard
that. Come
On
on.
that CAPS 5 to Dr. Curry certainly reported trauma-based symptomatology related to the abuse by Mr. Depp, but somehow that was not coded as such.
And did you review Dr. Curry's MMPI 2 that she administered on Amber Heard?
Yes, I did.
And do you agree with her interpretations on that test?
No, I do not.
Why not?
Because this profile is a normal profile. There are no clinical scores elevated above 65, which is 1.5 standard deviations of the mean, which is what we use to determine clinical significance.
Should we start playing bingo
And
now?
if none of those scales are elevated, it becomes very difficult for us to make assumptions about a person's psychology and their functioning. Now remember, the psychological testing generates hypotheses about a person that we then, using our clinical judgment, have to make a decision about. We have to make an assessment about it. And if none of those scales are elevated, it just doesn't give us rich information to make those determinations. The one scale which is accurate that was elevated was one that measures defensive responding, sort of a protective responding, an unwillingness to admit minor faults. That was elevated and that was true. But the result of that is you have a defensive profile. You have somebody who's not giving you a lot of information. So the scales are all low. So there's no way you can take that MMPI and then say it meets, it's consistent with borderline personality disorder. You just don't have the symptom expression on it in order to do that.
And
He was at
that's my
least
next
alive to
question
defend
here.
himself.
What, if any, diagnoses did you make of personality disorders for Amber Heard based on your testing?
I did not make a personality disorder of Ms. Heard.
Why not?
For a number of reasons. Number one, a personality disorder requires a pervasive pattern in a variety of contexts. 2 keywords, pervasive pattern, variety of contexts. That means if her
That's
emotional
4 words, but
instability,
that's
her
fine.
affect dysregulation, or her fear of abandonment
Pervasive
is
pattern,
only occurring
something in
the
context.
relationship with Mr. Depp, and we don't have evidence of it before, and we don't have evidence of it after, it is not
Better approach.
I mean, that was 4 words, right? I didn't make that up. Just making sure I'm losing brain cells over here. They're having sidebar. So when they go up there, they're having sidebars so that it's private. The jury can't hear it. And they're talking about private legal issues, facts of law, evidentiary stuff. Like they're having a private legal sidebar. It'll be in the transcript, but it's not for everyone to hear while they argue out legality. I'm gonna have to get up and do a lap around this house. Team Depp. She's getting prepared. She's like, damn, I should have read this shit before I came here, but 4 weeks wasn't enough. I mean, she's an expert, so she can testify to her opinions. Listen, calling the mom, she could have just said her mom was an addict or she had to witness. She didn't have to call her mom a heroin addict. That was fucking dirty. That was fucking dirty. I feel like it's going to be a massacre. Unless they're not worried about it and they just say, fuck it, ask 10 questions and go. But and this is why there's a bias with expert testimony. I'm not saying that's what's going on here, but you know, an expert's supposed to be honest whether or not it's good for who retained them or not. But obviously there's trust issues with expert witnesses because they are paid lots and lots and lots and lots of money by people to have their opinions. She's probably crying because that hair's tight and that bump it is high, and she probably has a headache from that hair. I mean, I get having to refresh your memory, but you notice everybody was like, if my notes say that, I have to refresh my notes, whatever. Like, if I was going to be on national fucking TV, shit. I get nervous about being on YouTube. Takes me like 5 hours to record a 12-minute video. And she's just like, fuck it, let me get up here and just not know my shit. To each their own, not judging. I know y'all see that fucking bump it. That or they tease the fuck out of it. I'm just saying. She's like, let me do a little quick review of these notes here. It's held all day. It's a bump it. Hey, they're helping her out. Let her review them. They're getting into it in the sidebar for sure. They're getting into it. They're hashing something out. Boy, that jacket has wings, doesn't it? Show us the penny. Give us the penny face. They're just having a sidebar, so they're just having a little legal battle, private legal battle over there. They're each saying why something is or isn't okay, and Penny's going to say, based on the law, what's okay and what's not okay. I'm choking on bullshit. Y'all send help. Oh. Anyways. Yes, they could call Dr. Curry back. Get it, Penny. Get it. Explain this shit to them. I'm telling y'all, perception matters. You could get up there and honestly just ramble about the dumbest fucking shit and be wrong. But if you're really likable, good looking, present well, funny, relatable, I mean, it's going to distract from the fact that you don't know what you're talking about. And if you know more information than anyone else and you get up there and you're an asshole and you're not likable, not presentable, like not vibing with them, then they don't care how smart you are because you didn't vibe well. I'm not saying that's the best situation, but that's just the truth.
Dr. Hughes, what, if anything, did Dr. Cowan say to you about any type of diagnoses of personality disorders?
Dr. Cohen did not diagnose Ms. Hurt with any personality disorder.
And what, if anything, did Dr. Bonnie Jacobs say about diagnosing Amber Heard with any personality disorders?
And Dr. Jacobs similarly did not diagnose Ms. Hurt with any personality disorder.
Thank you. Now, let's turn back to intimate partner violence. What types of physical violence were reported to you?
So there were a number of physically violent behaviors that were reported, that Ms. Hurd reported that Mr. Depp perpetrated. He pushed her, he shoved her, he slapped her with the front of his hand and the back of his hand. He choked her, he slammed her into the wall, he pushed her and she fell down. He kicked her in the back. Again, without looking at my notes, that's what I can recall.
You just had 20
And what
fucking
type of
minutes to
injuries
preview
did
them.
Amber Heard report to you?
She reported mostly bruising, pain, some cuts. She reported vaginal pain from some of the sexual assaults. She reported that she did have some scratches and cuts on her from broken glass. She reported that she believed she may have lost consciousness 2 times, once in the Australia incident and once in the December 15th, 2015 incident.
What type of coercive control was reported or did you find?
Beating,
Yep.
Sustained.
What, if any, coercive control was reported to you?
So the course of control that was determined in this relationship I found to be quite significant. There were many, many instances where Mr. Depp tried to control how Ms. Heard went about her career. He didn't want her to show nudity, he didn't want her to show boob, he didn't want her to act with certain actors because of this obsessive jealousy. He criticized her ambition. He'd rather she not work. He called, the ambition as something as a negative thing. It made her very fearful to have to look at scripts or talk about scripts or talk about movie roles because he persistently put those down and told her she didn't need to work and she didn't need to do that and she didn't need to show her tits and ass. He didn't necessarily support her work. The way this manifested as well is that he called almost every actor that she had to work with, males and females. So no matter what show she was filming or shooting, he would call the leading actor, he would call the director. He would tell you, I got eyes down there, I got eyes down on the set. So she never felt safe to be herself and be an actress in these films or productions because she'd have to come home and then endure his anger at her for doing something or for not doing something. When she was filming and he was in the same town, she feared that he would show up on the set and, to know what her call sheet, what she was filming that day. She, even told her assistant, don't give it to him, don't let him see it so that he won't show up. And sometimes he did. So it was very
Was he bringing
trepidatious for her, very
lunch?
anxiety-provoking
Was he picking her
that he
up?
continued to do this.
Was he just
He
showing
tried
up?
to
Like, what the
control
fuck?
what she wore. When she was going out with him, things were fine, but he told her often, no woman like mine is going to dress like a whore, and didn't want her to wear revealing clothing, or revealing clothing according to him.
Allegedly,
She
supposedly.
recalled an incident when she was going on a job audition, and he said, you're going to go out with those tits and ass, and she had to sort of go in and put on what she said mom jeans so that she didn't look sexy, so she didn't look revealing, and continued to try to plead with him about what jobs she could take and she could not take. This made her be very sort of restrictive and try to conceal things. She would hide her scripts because she couldn't read them in front of him because he would put them down or want to see where there might be nudity, where there might be something where she's doing a love scene. And then almost every person that she was in a film with, there would be those barrages of the consistent accusations of infidelity. And we saw that on the Australia pictures, the Billy Bob. He was one person that he continued, to berate her about having an affair with. That's what obsessive control looks like, those messages on the mirror. When you look at how he wanted her to there was some interference with the family, with her sister, when some things were leaked. He was obsessed believing that it was Whitney who did it, and eventually Miss Heard had to succumb and say, okay, yes, it was, and then alienate herself from her sister because she just couldn't take the fights anymore. She just couldn't take the constant barrage of criticism. So there were many instances when, in terms of their interactions, she would have to text him right back, but when she would text him, he could not answer for days. And it's this sort of, when we talk about, the ghosting, but your husband doesn't ghost you, your partner doesn't ghost you. And there were so many times of this sort of withdrawal of affection, which was on his terms and when he wanted to do it. I'm aware that there is, testimony in this case that, Mr. Depp decided to leave because he didn't want to be violent. And I do think that's true sometimes. I think he did leave.
It's on
in
fucking
times when he
record,
didn't want an altercation.
recorded.
He did leave after an altercation. He did leave and then came back and
And she
continued the
actually said, you
altercation.
always
So
leave. And he
leaving
said, I
was
won't
the
fight with
defining
you.
variable. The problem was that, with this obsessiveness and this perseveration that he had, the fight would always come back. So leaving might end the argument for that moment.
Honey, have you
But
heard
Miss Heard
the
knew He
audio?
was always going to come back, and he was going to, start the interrogation once again.
And what is the effect of the coercive control on Amber Heard?
I mean, the effect was drastic. She talked to me that she, her roles consistently dropped over the time that she was in the relationship with Mr. Depp, just because it was so difficult to go on auditions, to want to be in a different location with him. Whenever she was not on location with him, it was very stressful. It was very anxiety provoking because of the accusations of infidelity. We heard that through Isaac Baruch's testimony when she called and was saying, babe, there's no one here. There's no one here. That was something that she had to do repeatedly and constantly over the course of the relationship. So it caused a significant amount of anxiety, of distress, of having to try to conceal and maneuver around him to try to have the career that she wanted to have. It made her hypervigilant, and definitely contributed to sort of her psychological symptomatology getting worse over time.
What about sexual violence?
So there was a number of incidents of sexual violence reported in this relationship. Those
Allegedly.
are documented early on in Dr. Bonnie Jacobs' notes.
Are they? Because we
when
went
Mr.
over the
Depp was
notes.
drunk or high, he threw her on the bed, ripped off her nightgown, and tried to have sex with her. There were times when he forced her to give him oral sex when he was angry. These weren't in loving moments. These were angry moments, moments of dominance. Moments
It's time
of
to
him
whip
trying
out
to
the
get
"we're almost
control
asleep"
over her.
hat.
There was a time when they were in Hicksville in the trailer, I don't want to say trailer park, but I guess it's trailer park. It is a trailer park, where he was accusing her of a woman hitting on Amber. And that was the problem. Amber got accused of women hitting on her and got accused of men hitting on her. So there was.
I
so
think they're
many
gonna murk her on
targets
cross,
that,
so they're not fucked up about it.
came through in his obsessive jealousy. But when he, on that incident when Kelly Sue was accused of hitting on Miss Heard and they went back into the trailer, Mr. Depp performed a cavity search and ostensibly was looking for drugs and felt it acceptable to rip off her nightgown and stick his fingers up her vagina to look
Oh,
for pain. Thought that maybe she was
stop.
pregnant there. And again, these incidents often happen in a drug.
Like she's a drug mule at the fucking
There was another
airport.
incident
Stop,
in the Bahamas where when he got angry,
ma'am.
he took his fingers and he put them in her vagina and moved
Ma'am.
her around violently in the closet. Again, an act of sexual violence. And of course, the incident in Australia was one of the most severe instances of sexual violence that Miss Heard had to endure, in which when he was beating her and choking her and telling her, I'm going to fucking kill you, I hate you, I'm going to fucking kill you. And he grabbed a bottle that was on the bar and penetrated her with that bottle. And Miss Heard reported to me of dissociating and going outside of her body. And the only thing she was thinking is, oh God, I hope it's not the broken one.
What, if any, psychological abuse did you find?
There was a number of psychologically abusive behaviors. As I stated, Miss Heard admitted to me and reported that she engaged in those behaviors as well. She reported that she did call him names and offensive comments and said things to him that were horrible, and that she was incredibly saddened and horrified by her behavior. And looking back, she, at this point, not being in the constant barrage of abuse, does not recognize her. The abuse by Mr. Depp, he called her a number of names, frequently whore, slut, cunt, lesbian camp counselor, easy, ambition. Ambition was a weaponized term in that relationship. So he called her a lot of names and humiliated her. And of course, I think we talked about the intimidation tactics that, Mr. Depp was often banging and throwing and
It needs
hitting
to be.
things in the household, which sort of got the tension to rise up very significantly, very quickly.
Can you tell me how you conducted your analysis to arrive at these conclusions?
Sure. So what I did was look at the incidents that were reported and look at the corroborating data around it. So as we stated, most of these
He called
incidents
for
of
help.
intimate partner
They're
violence
searching
happen
for
behind
his
closed doors.
finger,
Not everyone is going to witness
cleaning up
what
the
parties are reporting behind
Okay.
closed doors. So you look at what is the data that surrounds
fact
it.
checking
there
is
any
clearly
data
not required
before
for
it?
this
Is there any
testimony.
data after it? Is the person telling? Is the victim telling somebody in real time about what's happening? Are there therapy notes? Are there pictures? Are there text messages that sort of allow us to fill in the pieces of the picture, even though we don't have exactly what happened at that moment? The more collateral that we have and the consistency across those data points, it gives us greater confidence in our results.
Can you give us some examples?
Sure. So
Vague.
Overruled.
So, for example, the Boston plane incident, I believe, without looking, I know May 24th, 2014. This is the incident.
I
where,
love that selective memory
Ms. Heard
she's
and Mr.
displaying
Depp
for
were gonna
us.
Fly back to LA and spend the
The
weekend
fuck? You
together.
can't
They were shooting at different sites.
you can't remember your
Ms. Heard is on the plane.
professional
waiting for Mr. Depp to
medical
come
opinions,
on, and
but you can
come
remember
back.
this.
Reportedly sitting in the SUV
All right.
smoking and
That's
drinking,
reassuring.
smoking weed and drinking. She is filming with James Franco at this point, and she gets on the plane and he starts talking about James Franco, making a lot of derogatory comments about her, and hope you had fun with
Let's
your
hope not.
escapades, and some more inflammatory language. And then in an
Would not be
argument, when
good.
she got up to leave, he kicked her in the back, and she went forward on the plane, to the front of the plane, because he sat in the back of the plane. So if I look at what is the
To be quick, she's
corresponding
an
data to
expert
this,
witness, so she
there's a
has
therapy note, several
hearsay
notes in Bonnie
exceptions.
Jacobs'
She can
records
testify
that
to
talk
opinions which
about
other people can't do.
Mr.
And
Depp
clearly they're not worried about
increasing
it,
use of
because I
alcohol
think they're going to let her dig a
and
hole
his
and then
excessive
murk her
jealousy
on
around
cross.
James
That's what
Franco
I'm predicting.
before this Boston plane incident. After the incident, Miss Heard told her friend Io. She told her friend Savannah. She told her friend Rocky. Miss Heard did not go home. She was afraid to go home. So she went to a hotel, because when Johnny was in these states, he would often show up because he's still in that drinking and drugging phase. And he talked about that. That was the roxycodone before he detoxed. He was still in that, high substance abuse phase, that he would often show up at night, and that did not feel safe. There was a text from Stephen Duders, Mr. Depp's assistant.
All right, you want to first?
What in the literal motherfuck are we watching? Like, first off, look, she's an expert witness, so she, you hear objection hearsay, objection speculation. Like, she's an expert, so the most simple version possible is that she has hearsay exceptions and can testify to opinions and things like that. It's like the most basic way to put. She's allowed to say more than a regular witness because she is an expert witness. That being said, I think they're letting a lot of shit fly because she's going to dig a hole, and then I am assuming on cross they're going to get up there and fucking eat her alive and discredit her by saying, well, did you know that Johnny was in the hospital and there were multiple people at the house, so there's no way this incident with the bottle happened? Or they'll discredit, like, they've got a game plan. Best believe that. Because they already know what she's going to testify and say ahead of time. Like, they know why she was retained and what she'll be testifying about. So you can guarantee that they know what the fuck, how to play it out. Or they should. They should know. I have a feeling they're letting her dig a hole to discredit her on cross. That's my opinion. Hey, I'm glad to have y'all. I would be right now without y'all. Like, just think if you were Team Amber and you heard everything Johnny had to say, how would that affect you? And then hearing this, would that validate what you originally thought, or would it cause confusion? I mean, that's what we have to think about. Right? I'm telling y'all, the chat with this live party is where it's at. We try to tell the crew on TikTok. Like, these graphic details, y'all, they're intentional. Come on. We've gone 4 weeks. We've gone 3 weeks in one day and have not had any type of vulgarity to that extent. She has come with the most, I mean, it's what's expected, right? Like, we knew this was coming. We knew this was going to happen. They just came right for it. Well, the live watch with commentary in the comments is going to be available when court's over, I'll hit end on this. It'll save and publish to YouTube. Or you can go to Court TV and watch it, or Sky News and watch the reruns without any commentary or comments. Law and Crime also has reruns. I agree with this. I agree with this. I just feel like hot mess express. Yes. So if you notice, like even if you're on your phone in the bottom right corner, there's like that little screw, like a if you click that, you can change how clear the view is.
Dr. Hughes, let's go past that text and talk about, go past that text and continue after that text.
Sure, so there was, Mr. Depp apologized.
I
to
guarantee
Mr.
they're letting her
Ferguson.
dig a hole and they're gonna murk
Mr.
her.
Depp
Guarantee
said in
it.
his UK testimony, well, I only maybe playfully tapped her on the back with my foot. Mr. Depp texted Paul Bettany and talked about how he was so drunk and out of control and engaged in bad behavior. He texted his friend Patty Smith a very similar type of text about how drunk and out of control he was. And then finally, Amber Heard wrote an email talking about how distressed and heartbroken she was.
Objection, hearsay.
I mean, I don't agree.
I'll sustain the objection. Next question.
All right. Can you give another example?
I think those are all I.
Aren't we
can,
waiting until Amber
remember
goes?
at
Should
this
we
point.
start them now? Y'all tell me in the comment section. We can start now, or we can wait till Amber gets up there.
What if any,
I don't think there will be
sorry, I'm
either.
gonna have to go a little bit further here. So you concluded that Amber Heard
Which is
used
strategic because they'll go
psychological
home
abuse
on a
in some
negative
reactive
note.
physical
The jury will
violence,
go
I
home
think
on
I
a
heard you
negative
say.
note.
Is that correct?
Objection, leading.
Overruled.
Can you please explain to the jury what you meant by that?
Yes, that is correct. That, Amber Heard reported to me, some of the behaviors that she used that were psychologically aggressive. The name calling, the putting him down and calling him, very bad names and insulting his fatherhood. And she was, very
So
ashamed and
true.
remorseful about that. She also indicated, using, and as some of the testing showed, minor forms of violence, pushing, shoving, throwing objects. We see that a lot.
You might
with,
need to
women
for
when there's not
witness
proportional
testimony.
force. Women are more likely to throw objects. And then the
Reactions from
more
Johnny's
severe act
side.
of punching him, which a punch falls in the more severe category. And the context, as she explained it, was that he was coming after Whitney, and she stood, her sister, and she stood in the way and she punched him.
Now, does that make Amber Heard a perpetrator of intimate partner violence?
Objection, leading.
Show is.
Overruled.
So that was one of the tasks that I had to consider. That was one of the hypotheses that I had to consider. And given all of the other data, that was not my opinion.
Now, you stated that you read a number of therapy records. Please tell the jury.
The honor policy?
Why are therapy records important?
That's the truth.
Therapy records are critical.
They're not
for a
sequestered, I
forensic
don't think.
psychologist. When we have the
Which is
opportunity
crazy.
to go back in time and see what a person was dealing with, what the content of their distress was, and what the symptoms of their distress was, it really gives us a snapshot in time. So they become very critical as part of the overall forensic psychological evaluation, because we as
Dare.
psychologists understand how people sort of treat in therapy and what to look for. So in looking back at Ms. Heard's therapy records, we see sort of real-time unfolding of this dynamic in this relationship.
Do you see the
We
power
see it
dynamic in
early
the
on
courtroom
in
though?
her notes.
They were
with-
objecting to
in her
everything.
report with Bonnie
Johnny
Jacobs
team's
and
like-
Dr. Bonnie Jacobs' notes.
We know we
reports
can
of
refute it, so
Constant concerns about Mr.
Continue
Depp's
with your
substance
fuckery.
abuse. Constant concerns about him passing out and vomiting. Constant concerns about.
I don't think
not-
Cross is
Objection, Your
gonna be
Honor.
today.
Hearsay.
I think Cross will be
She
tomorrow.
can characterize that and say she relied on that.
Overruled.
Thank you. Please continue.
Constant concerns about how do I get him into treatment? How do I get him help? Miss Heard starts going to Al-Anon at this point, early 2012, in the beginning of the relationship, because she has to figure out and wants to figure out a way to support the man that she's dating right now and the man who she's falling madly in love with. There were reports in Dr. Jacobs' notes
Okay, this
early
isn't
on
a fucking
about his
Disney
control
novel.
behavior,
Chill out.
about his jealousy behavior, about him not wanting to do certain jobs, of not wanting her to wear certain clothes. So this is going back to
Says
2012.
who about the clothes? Come on.
With no indication of why would she be saying that, but for the sole purpose of trying to get help and trying to get guidance in this relationship that she finds so difficult.
And that is where
There
you
are
messed up,
indications,
ma'am.
as I
Holy
mentioned
shit.
before, of the sexual assault,
Come
and the
on.
sexual abuse, and how he would, when he was angry,
Come
and
on.
when he was drunk, it was mostly drug and alcohol fueled rage when he would, throw her on the bed and try to have sex with her. And then, if he was not able to perform, he would get more angry at her.
Now
And
he
blame
has
her. So
erectile
this dynamic
dysfunction,
of
bitch.
blaming
Come on.
her for his inability to take responsibility for his behavior.
Come
Those themes
on.
were throughout Dr. Jacobs' notes.
Is she
Did-
serious?
Did Dr. Jacobs assign any diagnoses to Amber Heard?
She did.
Which
Early
one?
on, she diagnosed her with panic disorder.
I'd sue her
and
for
then
saying I had
later with
erectile
post-traumatic
dysfunction.
stress disorder.
Have you seen me refill the meds for it?
And
Do I have
did
a
Dr. Jacobs
prescription for
diagnose
it? Can you prove
Amber
that,
Heard
ma'am?
with borderline personality
God
disorder?
bless.
No, she did not.
Histrionic personality
Were
disorder?
you there?
No, she did not.
When you couldn't
is that
perform, were you
important?
there?
That's very important when we're trying to figure out the course of somebody's illness, the course of somebody's psychiatric difficulties. As I stated, well, I don't think I got to state, personality disorders usually start in
Yeah,
adolescence.
Cross won't be
early.
today.
Objection.
Cross won't be
Cross
today.
sustained objection.
No way.
Next question.
Okay. You also stated that you reviewed Dr. Connell Cowan's treatment notes.
They're
correct?
letting her dig a
Correct.
hole, I'm
And you
telling
also
y'all.
read his deposition
It's gonna be
testimony?
a fucking
Correct.
work in the
And you
morning.
had, how long of a collateral interview with him?
I believe it was 2 hours.
Okay. And what did you get from all of that data?
So by the time that she gets to Dr. Connell Cohen, which is 2014, I believe, September 2014 is when Dr. Kipper comes on the scene. Miss Heard's psychological functioning is significantly deteriorated. She's suffering more anxiety, more sleeplessness, more agitation, more emotional dysregulation, this fluctuation in moods. And when you sort of look at the records of what happened in those first 2 years from Dr. Jacobs, and now we have up to Dr. Connell Cohen, and we see all of the incidents that she was exposed to, including the sexual violence and the coercive control,
Like,
it
what
makes sense to
the
me that her
fuck?
status, her psychological functioning has deteriorated. And in Dr. Connell Cohen's notes, that's what he's always trying to do. He's trying to help her, help Mr. Depp. help
Right?
her
It's watching with
act in
friends.
a way
Way better.
so that Mr. Depp does not hurt her. Mr. Depp, Dr. Connell Cohen was very concerned for Amber Heard's safety.
Can they not get
as was
anybody's
Dr.
name
Bonnie
right?
Jacobs. Dr. Jacobs was very concerned for her safety, and she continued to talk about safety aspects for Ms. Heard, as was Connell Cohen. They did, both of them, both therapists understood, and Ms. Heard talked to them about it, that there were times that she fought back and she used violence, and times that she screamed and she said things that she didn't want to.
Oh yeah.
But nevertheless, that did not change the balance for them either, and they were very concerned that because of Mr. Depp's significant substance abuse and his sort of poorly controlled anger, that at some point he was going to seriously hurt her.
Did Dr. Cohen provide Ms. Heard with a diagnosis of borderline personality disorder?
No, he did not.
Did he diagnose Amber Heard with histrionic personality disorder?
No, he did not.
Is that important?
It's important that you have an individual, Ms. Hurd, who's in therapy for over 2 years with one therapist and over 2 years with another therapist, and you're not seeing those characteristics of a personality disorder. If the manifestation of a person's difficulties and illness and symptomatology is better explained by another disorder, then you don't qualify.
Right,
for
but
the
there's also people that have
personality
been
disorder. You
like
can't get the
dying trying to get
diagnosis,
help for
and that's
years. They've
part of
seen
the
50
criteria.
doctors and they
So
go
if
to
it's
this
not a
one random
pervasive
doctor
pattern, a
that
variety of
realizes what
content,
they have
and
and
it
cures
can't be
it.
better explained by her trauma experience and the exposure and the
So
symptoms
that
as a
goes
result
both
of that
ways.
trauma, then you don't get a personality disorder. And that's why they didn't diagnose it.
Did you read Dr. Amy Banks' deposition testimony?
Yes, I did.
And what were her findings?
So Dr. Banks had one session, one couple session with Mr. Depp and Ms. Hurd. Dr. Banks is very reputable. She works up at the Harvard Medical School Cambridge Victim of Violence Program, which is a very well-known program for understanding
Objection, Your Honor.
What's the objection?
It's non-responsive to the question. The question was, what was the findings?
All right.
Tell the jury who Dr. Amy Banks is.
And just like I said, so she's somebody who has a wealth of experience in understanding intimate partner violence and the dynamics of violent relationships. But she only had one session with the couple, and it was her determination when they were both there and the violence was talked about that Mr. Depp did not deny the violence that he perpetrated toward
Wow,
Ms.
that
Hurd.
one session must
She
have been
also did,
a
as
showstopper.
everybody has, all of our other therapists, because Mr. Hurd admitted as such, that she also used low levels of violence as well. So Dr. Amy Banks had that opinion.
Did you review Dr. Laurel Anderson's treatment notes and read her deposition?
Yes, I did.
Okay, and what was the significance of what you learned from Dr. Anderson?
So Dr. Anderson similarly thought that there was violence and abuse in this relationship. She was the one therapist out of the 4 who qualified it as mutual abuse, which the termination I've talked to you about, I don't necessarily agree with. But she did see and did understand that there was violence and abuse by Mr. Depp. What was most notable was that after the December 15th, 2015 episode, Ms. Hurd called her in addition to calling Connell Cohen and reached out to a number of people, but she saw Dr. Anderson in her office. And Dr. Anderson saw 2 bruises on her face and told me, my husband kicked me and he pushed me and he punched me in the head. And should I call the police?
Objection, Your Honor,
What should I
hearsay.
do?
She's not reading, Your Honor. She's just saying the significance. of it.
Sustain the objection. Next
Okay.
question.
All right. What were your, what conclusions did you make as a result of what you reviewed for Dr. Laurel Anderson?
My take of reading Dr. Laurel Anderson's deposition and seeing her, redacted notes was that, from my professional opinion, this was a very serious incident and a very serious allegation of intimate partner violence by Mr. Depp. If a patient comes into my office with 2 bruises and alleges being pushed, shoved, and kicked by her partner, I'm going to be very concerned and I'm going to mobilize a lot more resources to help that individual. And for some reason, that did not happen for Ms. Hurd.
What are your overall clinical impressions from reading these notes from Amber Heard's treatment providers and the couple's therapists?
Objection, compound.
All right, sustained.
What are your overall clinical impressions from reading what you told everybody you read?
Objection, compound.
I mean, I don't know how to get it less compound, Your Honor.
Overruled, go ahead.
Thank you.
So my overall impression of the treatment notes was, there's significant support for the fact that there was intimate partner violence in this relationship. It was consistently reported over time, and there were couples therapists who saw and understood that. There were, Mr. Depp also attended a session with Dr. Connell Cohen with Ms. Hurd. And in that session, he was very belligerent and mean and yelling and intimidating. And he even got up and stormed out rolled a joint, and then came back later. Dr. Connell Cohen's impression was this is somebody who's poorly controlled. That's the same thing that Dr. Laurel Anderson said about him. And he stormed out of one of those sessions too. So there were a total of 6 sessions, couple session, but Mr. Depp stormed out of 2 of them. So there were only 4 couple sessions for these 2 individuals in this just highly volatile, highly damaging relationship that was, punctuated by the coercive control and the intimate partner violence.
What, if any, observations did you make about Amber Heard's psychological status over that period?
I mean, the record was very clear that her psychological status deteriorated as she was in the relationship with Mr. Depp. She kept getting worse. She was losing weight. By the end, she was down to, I think, 105 pounds from about 125, 130. She was taking significantly more medication than she's ever taken in her life. She was having more panic, more anxiety, more distress, more affect dysregulation, just really an inability to regulate her mood, more anger outbursts. So it can significantly deteriorate over time.
You talked about weight. What, if any, diagnoses did Bonnie Jacobs make about Amber Heard having an eating disorder?
There was no evidence in the record that Ms. Heard had an eating disorder.
What, if any, observations did you make about whether Dr. Cohen Connell thought she had an eating disorder?
There was no indication in his record that she had an eating disorder.
Now, what, if any, observations did you make about the impact of Mr. Depp's substance abuse?
So the substance abuse was a very relevant and complicating factor to this relationship. When you pair that level of substance abuse with the level of intimate partner violence and coercive control, it's a very, very disastrous mix. And one of the things that happens with the substance abuse is a very similar dynamic that happens with the intimate partner violence, that there's the lying, there's the hiding, there's the cheating, there's the obfuscation, the rationalization about the drinking, the rationalization about the violence, the trying to, promises, I'm going to do better, I'm going to get clean and sober, I'm not going to hit you anymore.
Objection,
So
Your Honor. Can I be heard?
You can approach.
What, if any, dynamics and coping styles are connected to the substance abuse by Mr. Depp?
So they share similarities. There's a lot of lying when somebody's a substance abuser. There's a lot of hiding. There's a lot of concealment. There's a lot of rationalization. There's a lot of blame, blaming your partner for your inability to stay clean and sober. There's a lot of the promises to change and the promises to get better. So a lot of these dynamics sort of co-occur, in a situation of substance abuse and domestic violence. They're very similar. The difficulty in this relationship was that the majority of the violent episodes and the sexually violent episodes were in these alcohol and drug-fueled rages. That was predominantly when those happened. When he wasn't in those stages, we still saw the obsessive jealousy and the coercive control and the possessiveness. That still persisted. But when the alcohol and the drugs came together is when Amber Heard was more in danger of being hurt by him.
Why didn't Amber Heard leave the relationship sooner?
I mean, you know what.
Objection, speculation, Your Honor.
Have you formed, based on your experience and based on your 29 hours of clinical evaluation of Amber Heard, what is your understanding of why Amber Heard didn't leave the relationship earlier?
Objection beyond the scope of the disclosure.
It clearly is not. I mean, it's clearly in the disclosure. Point to where you say it's not. I mean,
Which where you say it's not.
Yeah.
Could you?
So a reminder that in pretrial hearings, Amber brought her own mental health into question when she hired a doctor to evaluate her for PTSD. When she did that, it opened the door for Depp team to hire Dr. Curry to evaluate her mental state since she brought it into question. But since Johnny never brought his mental state into question, he didn't get evaluated.
now you indicated that your main opinion was that Amber Heard's report of violence and abuse in her relationship with Mr. Depp is consistent with what is known as intimate partner violence, correct?
That's correct.
Okay. And why did you believe that Amber Heard, what formed your basis of that opinion? In a nutshell.
Asked and answered, Your Honor.
Overruled.
The basis of the opinion was looking at all the dynamics in this relationship, looking at not just the hitting and the yelling, but looking at how much more hitting was done, looking at the coercive control, the obsessive jealousy, the possessiveness, the sexual violence, the choking behavior, the threats to kill. Those are all, as I stated, very significant and often found in cases of lethal domestic violence. Those were significant severity factors. And looking at all those, that's what tipped the scales. That even though she yelled and said some horrible things and hit him, never was able to shift the balance of power and control in that relationship.
Now, you have discussed with Amber Heard and you have reviewed and evaluated the emotional impact on Amber Heard as a result of emotional distress as a result of the 3 counterclaim statements, correct? The 3 alleged defamatory statements made by Mr. Depp through Mr. Waldman, correct?
That is correct.
Okay,
Objection,
And-
compound leading.
just
Overruled. Go ahead.
thank you. Could you please tell the jury what psychological impact these statements had on Amber Heard?
Yes, so there were 3 statements that I evaluated. May I check my notes to give you the dates and my recollection so that I can be clear?
Since I couldn't put it in, that's might be the fastest way, Your Honor.
I'd rather should not address the court.
I'm sorry. Yes. you
Okay.
can- Yes.
So there were 3 statements on April 8th, 2020, April 27th, 2020, and June 24th, 2020 that I queried her about and asked her about. The one that, what happens is if somebody who, like Ms. Heard, has trauma-based symptoms and PTSD, we say that PTSD is a cue-based disorder. There are things that happen in the environment that trigger it and make it worse. And have to refute that your report of violence and abuse is a hoax makes that trauma activated. So it makes the PTSD symptoms at that time become more intense and more severe. So she would have more intrusive thoughts, more nightmares, more sleeplessness, more difficulty engaging with other people, depression, sadness, stress. All of that would happen when one of these statements came out. The one that was, the most difficult was the one where they said that her sexual violence
Objection, Your
was
Honor.
a hoax.
What's the objection?
I think she's going to
I'll overrule objection.
Please continue.
The one that was most difficult for Ms. Heard was the statement about calling her sexual violence a hoax. As I stated earlier, most women try very diligently to put that sexual violence in a box, bury it down, not want to talk about it, not want to have anything related to it come up. And she's done, by my estimation, her coping, although she suffers from post-traumatic stress disorder, she also has a high degree of coping strategies. But when this would happen, it sort of everything would deteriorate. And this is the one thing that women are always afraid of, that no one's going to believe them, no one's going to take them seriously. And when somebody comes out in the popular media and calls your experience a hoax, that lended itself to more severe psychological and traumatic symptomatology for her.
Dr. Hughes, are all of your opinions that you have provided today within a reasonable degree of psychological probability or certainty?
They're taking
Yes,
notes.
Thank you.
They leave them in their chair at the end of the day, get them again in the morning when they
This
come.
is a good time to go ahead and break for the day. We can have cross-examination and redirect tomorrow of this witness, of Dr. Hughes. So if you could have a
Thank
good
Jesus.
evening, do not discuss the case with anybody, and don't do any outside research, okay? We'll see you in the morning. Thank you.
Holy hell, y'all. Whew. That was fucking painful.
Okay. All right, Dr. Hughes, since you're still in the middle of your testimony, please don't discuss your testimony with anybody, including the attorneys, okay? And anything that you looked at, referenced during your direct examination, if you could just turn that over so they can review that before cross-examination, okay? All right, thank you,
Your
ma'am.
Honor, may I just, I presume she wants to be able to take that back with her.
We can get copies of it. We'll get whatever it is.
Okay, great.
We'll make sure you get copies of it. So make sure you get copies of it so she can keep her originals. Okay?
Yes, thank you.
All right.
I have copies of everything that I looked at. Other
Okay.
than
Well, no. We're not talking right now. Of course, in session. Thank you. All right. So anything else then? So we'll see you tomorrow at 10 a.m. Correct? All right. Thank you. Have a good evening.
Wow, fuck. What did we just watch? Ooh. That was a lot, right? That was a lot. That kind of speechless there. That was A lot. Anything we need to go over? Y'all told me to check messages. One
Y con eso
second.
ya podemos ir evaluando entonces cómo el cambio climático va a afectar estos ecosistemas. Y eso cómo
That was some rough shit. Yeah. Need to digest that shit. Yes, good luck tomorrow, Sam. They have to be letting her dig a hole. That's the only thing I can think. Like, they have to be letting her dig a hole, and then they're gonna hit her with some facts to make her look stupid on cross. That's the only thing I can think of. That she had some very selective memory, right? Some very selective memory. Couldn't remember her professional opinion on things, but could remember everything that Johnny did, allegedly. I think them not yelling a bunch of objections. Ooh, I look ratchet. Them not yelling a bunch of objections. I don't think they're worried about it because I think that they're going to get her on cross. That like I absolutely think they're going to get her. I think this is going to be drug out for a while. I think this particular witness is going to be drug out for a while. That has to be what they're doing. They knew what her testimony was going to be about. They know why she was retained and what to expect from her testimony. I'm sure they prepared for this, and they're just letting her go. Also, like, she didn't fact check. Like, how did she verify half the shit that she said? You know, like, she just took it at face value as factual. Yeah, I hear that's so true. I'm assuming this is in the notes that she had a hard time remembering, but could remember that it has to be in their notes. Those claims were fucking wild. When she said he had erectile dysfunction, all I could hear was Johnny saying, "Were you there? But were you there?" Like, there was just some shit that was just like not cool. Like, you could have just said that your dead mother was an addict, but you threw her under the bus for being a heroin addict. No judgment, no shade. Y'all know I'm big about the opioid crisis. That's some real shit. We all know somebody who's either been an addict, is an addict, lost their battle with addiction, which, by the way, in recovery terms, like, even if you've been sober 10 years, you would still identify as an addict. Either way, no shade whatsoever. I'm just like, I can't believe you, like, you had to throw her under the bus like that. Come on. Any other questions before we digest this and reconvene tomorrow morning? That's exactly what I think they're planning on doing. I think I think they're letting her have a free for all because they're planning on coming back on cross with proving her statements as false or appearing to be false. That's what I think. That's exactly what I think they're preparing to do on cross. For example, the bottle incident. Like, when did she claim that happened? Because there were multiple people at the house. He had to seek medical treatment for his finger. They were searching for his finger. Like, they're going to call her on some shit for show. What does murk mean? Like, murder someone, murk them. It's like a, don't get murked, don't get murdered. I don't think they're done questioning her, but cross should be tomorrow, absolutely. Her parents' text messages are very telling. I have a copy of her text messages, her parents' text messages with Johnny. They're very interesting. Erectile dysfunction. And she made some statement like when he was trying to have sex with Amber and then he couldn't, aka erectile. I mean, am I the only one that took it that way? Because instead of her saying like trying to have sex with her and he couldn't, meaning like she didn't want to, I took it as her insinuating he had erectile dysfunction. Was it just me? Did y'all think that too? Like, did y'all take it that way too? Or was it just me? Couldn't perform. Okay, right. So yeah, that's for sure what she meant. Okay. I'm making sure we're all on the same page here. That's what she meant. All right. Okay, we're all on the same. Yeah. I'm like, were you there? What? They did have a lot of sidebars. I can see why. She just really made a lot of accusations, didn't she? There were so many accusations. That's what I'm saying. I mean, the thing is, like, Team Depp, they said what they needed to say, but I don't think they were disgusting. And also, like, Johnny admitted to some text messages that, like, people with dark sense of humor didn't think anything of it, but people that don't, are going to, like, fixate on the Honda Civic joke, which, okay, they just have a dark sense of humor, whatever. But here it's like, fuck Johnny. She didn't do anything wrong. They will not even give an inch of blame on her. Yeah, they can be different. I mean, you can have several people go to a doctor and get different diagnoses. I mean, girl, I don't blame her. That was a lot to digest. Like, fuck. But here's the thing. If she was talking about like a rape case or a sexual assault case, like I would expect that plus 10 times the detail. But I just, like, we just jumped into that. It kind of just came out of left field. Like, we've not introduced those claims. Boom, let's just go, balls to the wall on that. Just fuck. People are very sensitive. People are very sensitive. I'm not judging it, whatever, but you got to have a sense of humor to get through some of this shit, honestly. So Dr. Curry explained why she used the test that she used. Like, they tried to throw that shade and say, like, why'd you use this testing? And they said, like, is it the newest testing? Amica Umbridge said, is it the newest testing? And she said, it's not the newest, but it's the one with the most research, the one that's been utilized the most, has the most reliability in her professional opinion. It sure did. It sure did. Whew. It sure did. Okay, is that it for today? We'll reconvene bright and early tomorrow. I'm going to check in on TikTok. So if you want to keep talking, you can switch back over there. And then we'll just digest that fuckery and hit tomorrow morning. I did not see what paper they gave that guy. I mean, I don't know. They could give him a book. There's nothing that can help her, I don't think, at this point. Thank y'all for joining the watch party, because it would be nothing without all of y'all. Y'all make it what it is. So everyone go get a mega pint for themselves. For show. Okay, I will see y'all. Like I said, I'll do a check-in on TikTok, so you can go over there if you want to. Otherwise, I will see you all bright and early for the fuckery.